The night the black military helicopter dropped onto the roof of Callaway General Hospital, every doctor in the trauma bay assumed it had come for them. They were wrong. It had come for the nurse. The same nurse Dr. Raymond Stokes had called incompetent 3 days earlier in front of the entire department. The same nurse who had been transferred to supply restocking because he said she made him nervous. The same woman who had spent 3 months being invisible, quietly absorbing every insult, every dismissal, every casual cruelty, while carrying a classified service record that none of them were cleared to read. The soldiers didn't ask for the chief of trauma. They didn't ask for the department head. They walked past every doctor in that hallway and asked for her by name. Before this story goes any further, if you've never seen one of these before, you're in the right place. Hit subscribe right now, because the stories on this channel don't go where you expect them to. Hit the like button if you're already feeling something, and drop a comment telling me what city or country you're watching from. I genuinely want to know how far this story has traveled. Don't click away. You need to see how this ends. The rain had been falling on Calvert City, Oregon for 6 straight days. Not dramatic rain, not the kind that makes people stop and look out windows, just the low, persistent gray drizzle that settled into the bones of the city and refused to leave. The kind that made the inside of Callaway General Hospital feel smaller than it actually was. The corridors more narrow, the fluorescent lights more yellow, the tempers shorter. Nora Callahan had noticed it the way she noticed everything, quietly, from the periphery, without drawing attention to herself. She was 31 years old, with dark hair she kept pulled back in a knot so tight it sometimes gave her headaches by the end of a shift. She had a small scar above her left eyebrow, faint now, that she'd stopped bothering to explain. She had brown eyes that were good at looking neutral, good at absorbing information without broadcasting reaction. Those eyes had been trained. Most people who worked with her didn't know that. Most people who worked with her didn't think about her much at all. That was by design. She had transferred to Callaway General 11 weeks earlier, arriving with a resume that listed prior nursing work at a regional hospital in Western Washington, and a certification in emergency trauma response that the hiring coordinator had glanced at for maybe 4 seconds before stamping the paperwork approved. Nobody had looked closer. She hadn't wanted them to. The trauma department at Callaway General ran on a rigid social architecture. At the top sat Dr. Raymond Stokes, chief of emergency trauma, a 53-year-old man with silver temples and the particular confidence of someone who had been told he was exceptional so many times that he'd stopped distinguishing between confidence and arrogance. He was not a bad doctor. He was, in fact, a genuinely skilled surgeon in a narrow technical sense. But he was the kind of skilled that had curdled over the years into something less useful, the kind that needed an audience, that required the room to understand it was witnessing excellence. Below him sat his senior attending physicians in a loose hierarchy of mutual reinforcement. Dr. Patricia Nguyen, who was technically brilliant and had learned early that agreeing with Stokes moved her career forward faster than challenging him. Dr. James Hartwell, whose trauma assessments were fast and accurate, but who had a habit of speaking over nurses mid-sentence, not from malice exactly, just from a practiced indifference to their presence. And Dr. Serena Okafor, the newest attending, only 2 years out of residency, who was still figuring out how the social physics of the department worked, and who compensated by being louder than she needed to be. The nurses occupied a separate universe. They kept the department running. Everyone with any honest perspective knew this. The nurses caught medication errors. The nurses noticed the patient in Bay 6 whose oxygen saturation had been quietly dropping for 20 minutes while the attending was writing notes. The nurses knew the codes, knew the equipment, knew which vending machine on the 3rd floor actually dispensed what it displayed. They were essential in the precise way that foundations are essential, invisible until something went wrong, and then suddenly everyone was very interested in what had been there all along. Nora Callahan fit into none of the social categories cleanly. She wasn't close with the other nurses. Not unfriendly, just contained. She ate lunch alone most days, not from sadness, but from preference, sitting by the window in the break room with a book she may or may not have been actually reading. She completed every task she was given, completely and without complaint. She asked appropriate questions and offered no unsolicited opinions. She did not gossip. She did not compete. She showed up 12 minutes early every shift and stayed until the work was done. This, paradoxically, made people uncomfortable. "She's weird," said one of the night nurses, Donna Phelps, to anyone who would listen. "Like too quiet. Nobody's that quiet unless they're hiding something." "She's fine," said Marcus Webb, one of the senior nurses who had worked trauma for 9 years and had the steadiness that came with it. "She's just not trying to impress anybody. Some people are like that." "She made a decision in Bay 3 last week without consulting the attending," Donna said. "Just acted. Like she knew better." "Did the patient do okay?" Donna paused. "That's not the point." The point, to Donna and to a handful of others, was that Nora Callahan didn't perform deference. She was respectful. She followed protocol. But there was something underneath the compliance that wasn't actually submissive, and people with sharp social instincts could feel it even when they couldn't name it. It felt like someone choosing to be quiet, not someone who had been made quiet. Dr. Raymond Stokes had noticed it immediately and decided he didn't like it. The first incident happened during Nora's 3rd week. A patient came in, male, mid-40s, presenting with chest pain that the triage team had logged as likely costochondritis. Inflammation of the cartilage around the rib cage, uncomfortable, non-threatening, not a cardiology emergency. Nora had been assigned to monitor him while the ER processed a higher priority case in the adjacent bay. She spent 4 minutes with him, asked him questions that weren't on the standard intake form, watched how he shifted his weight when he breathed. When the on-call attending came to sign off on his discharge paperwork, Nora had said quietly, "I think we should run a D-dimer before he goes." The attending, Dr. Hartwell, had looked at her with the patient still in earshot. "It's costochondritis, Callahan. His pain doesn't fully localize to the costal cartilage," she said. "He's also had some recent long-distance travel, and his left calf is slightly warmer than his right." "Are you suggesting a pulmonary embolism based on a warm calf?" "I'm suggesting a D-dimer is 20 minutes and rules it out." Hartwell had ordered the test, more to stop the conversation than because he believed her. The D-dimer came back elevated. CT confirmed a saddle embolism, a blood clot sitting at the bifurcation of the pulmonary artery, a potentially fatal finding that had been 2 hours from becoming a catastrophic event. The patient survived with anticoagulation therapy and a 3-day inpatient stay. Hartwell got a commendation note in his file for the catch. Nora's name appeared nowhere in the official record. She hadn't expected it to. What she hadn't anticipated was that Hartwell, slightly embarrassed, would mention to Stokes that the new nurse had pushed for the test, and that Stokes, upon hearing this, would decide the situation needed to be addressed. He found her restocking supply carts on the following Tuesday afternoon. "Callahan?" She looked up. "Dr. Stokes. I heard about the Harmon case." He folded his arms. He was tall, and he had a way of positioning himself that used his height deliberately. "I want to be clear about something. This department runs on a specific chain of decision-making. Nurses flag concerns through the charge nurse. Diagnoses belong to physicians. When you start inserting yourself into clinical judgment calls, you're not helping. You're creating liability." Nora looked at him steadily. "The patient had a saddle embolism." "That is not the point." "What is the point?" The question landed differently than he expected. Not aggressive. Just literal. She actually wanted to know what the point was. "The point," he said, his voice dropping half a register, "is that we have a system. You're new here. You don't know the system yet. Follow protocol, do your job, and leave the clinical decisions to the people trained to make them." "I am trained in clinical assessment," she said. "You are a nurse," he said. "Act like one." He walked away. Nora watched him go. Then she turned back to the supply cart and continued restocking, her face giving away nothing. The second incident happened 2 weeks later and was worse. A trauma came in late on a Thursday evening. A 28-year-old woman who had been in a car accident, T-bone collision at an intersection, significant impact to the driver's side. She came in conscious but disoriented, with a lacerated forearm, bruised ribs, and a blood pressure that was lower than it should have been for someone whose visible injuries didn't fully account for it. Stokes was running the trauma. He'd assessed the arm, ordered imaging for the ribs, and was confident in the picture he was building. The BP was low, he reasoned, because of pain and shock response. They'd fluids her up and monitor. Nora was the assisting nurse. She stood at the patient's left side, tracking the monitors, watching the numbers, and watching the patient herself. The way the woman's breathing was slightly too shallow, the way her abdomen was tighter than it should have been on palpation, the way her pressure wasn't responding to the first fluid bolus the way it would have if this were purely shock response. "She may have internal bleeding," Nora said. Stokes didn't look up from his suture work on the forearm. Imaging showed no rib fractures. "She's stable. Her pressure isn't improving with fluids. She's anxious and in pain. That suppresses vascular response. Her belly is rigid." He looked up then. The look was not curious. "Callahan, I'm in the middle of a procedure. If you have a concern, document it and let the charge nurse know." By the time I said document it, Nora looked at the patient. The woman's name was Tricia. She had a small butterfly tattoo on her left wrist. She looked scared in the specific way that people look scared when they can feel something is wrong with their own body, but everyone around them is being calm, and so they think maybe they're overreacting. Nora documented her concern, flagged the charge nurse, and stood at the bedside and kept watching. 40 minutes later, the ultrasound tech ran a fast exam as part of the standard secondary survey and identified free fluid in the abdomen, blood pooling from a splenic laceration that hadn't been visible on the initial images. Tricia went to the OR in an emergency. She survived. Stokes, in the debrief, said the splenic bleed had been identified through standard protocol and managed appropriately. He did not mention the 40-minute delay. He did not mention that the nurse had flagged it first. 2 days later, he reassigned Nora from trauma bay coverage to supply management and administrative support. The paperwork cited team integration concerns and workflow friction. Marcus Webb found her in the supply room the next morning, counting gauze packs with methodical precision. "He actually did it," Marcus said. "Transferred you to supply." "Looks like it." Nora, that's not okay. That patient almost..." "She's fine," Nora said. "That's what matters." "That's not..." He stopped. "How are you not angry right now?" She set down the gauze pack. She thought about it honestly for a moment. "I've been in situations where getting angry made things worse," she said. "I learned to find other uses for it." Marcus looked at her for a moment. "What does that mean?" "It means I'm fine," she said. "And Tricia's fine. So I'm going to count these supplies and make sure the trauma bays are stocked, because that's what the department needs right now." She went back to counting. Marcus stood there for another few seconds, then left, unsure what to do with the feeling he had, that he was watching someone practice a very specific, very deliberate form of patience that he didn't entirely understand. The storm got worse on the night of the 14th. Calvert City weather had a way of building pressure without obvious warning. Cloudy for a week, temperature dropping, and then suddenly at 9 or 10 p.m. the sky would open up in a way that felt genuinely violent. Rain horizontal against the windows, gusts strong enough to shutter the older sections of the building. Nora was in the supply corridor on the 3rd floor, midway through an inventory reconciliation that nobody had asked her to do, but that clearly needed doing. The PAR levels were off. 2 trauma bays were going to run short on specific catheter types within 48 hours if nobody caught it, and catching it was now, technically, her job. She heard the rotors before anyone else. That was not an exaggeration. The sound registered in some part of her nervous system that had been calibrated for exactly this. The specific percussive thud of military rotors in bad weather, the way they cut through rain differently than civilian aircraft, the approach pattern that said this was a direct, urgent descent rather than a transit or routine landing. She set down the inventory tablet. Below, in the trauma wing, the overhead PA crackled. "Attention all trauma personnel, possible incoming medevac. Stand by for rooftop landing. Stand by." She was already moving. The rooftop landing pad at Callaway General was a legacy feature from the hospital's original construction, updated twice in the past decade, but still smaller than ideal, lit by a grid of embedded lights that activated automatically when the landing protocol was triggered. By the time Nora reached the 4th floor corridor that connected to the stairwell exit to the roof access, she could see through the narrow window that the helicopter was already down. Not circling, not approaching, already down, which meant whoever was aboard had been flying in conditions that would have made most civilian pilots request alternate clearance. She didn't take the stairwell to the roof. She took the elevator to the trauma bay level, because that was where they'd be bringing whoever was inside. The doors were already open when she reached the ground floor. Not the ambulance bay, the side entrance, the one that connected directly to the trauma corridor, the one you used when you needed a direct line. Two figures in tactical gear were pushing through first, flanking a third person on a gurney, and behind them came two more. One of them carrying a medical bag that Nora recognized by its straps and configuration before she could see the patches on it. The man on the gurney was big. Even lying down, even with the thermal layer cut open at the shoulder and his face gray from blood loss, you could tell he was the kind of large that came from years of specific physical work. His left thigh was wrapped in a compression bandage that had bled through entirely, dark, saturated, telling a story that Nora read in about 2 seconds. The team moving him was moving fast, which was good, but they were also moving with the specific controlled urgency of people who had already been managing a bad situation for too long and were starting to hit their limits. Dr. Stokes was already in the corridor, drawn by the PA announcement, still in his dress shirt from whatever administrative meeting he'd been attending. He stepped forward with the particular authority of someone accustomed to rooms rearranging themselves around him. "I'm Raymond Stokes, Chief of Emergency Trauma. What are we dealing with?" The man at the front of the team, not in uniform, but carrying himself with a command posture so embedded it came through anyway, looked at Stokes with eyes that did a quick professional assessment and arrived at some internal conclusion. "Petty Officer First Class Danny Ochoa," the man said. "Combat medic. Our CO took a high-velocity round fragment that clipped the femoral region, possible secondary vessel involvement. We've got a through-and-through penetration with controlled hemorrhage that we've been managing for 64 minutes. "All right." Stokes moved to keep pace with the gurney. "Trauma Bay 1. We need to know who you've got for vascular trauma," Ochoa said. He wasn't being rude, he was being efficient. "Specifically, penetrating injury to the proximal femoral region with suspected lateral circumflex involvement." "I'm your man," Stokes said. Ochoa glanced at him. "With respect, sir, we were told this hospital has a specific clinician who does bilateral vascular trauma assessment." Stokes stopped moving. "We have an excellent surgical team." "I was given a name," Ochoa said. "Callahan." The corridor went briefly very quiet. Stokes's expression did not change outwardly, but something behind his eyes shifted. Confusion first, then something harder. "Callahan is a supply nurse." "I don't know what she is here," Ochoa said, and his voice was still professional, still controlled, but there was a quality in it now that was not open to extended negotiation. "I know what she was rated for, and I know what's in that man's thigh, and I'm asking you to find her." Nora stepped out of the doorway where she had been standing and watching. "I'm here," she said. Every head in the corridor turned. Ochoa saw her, and his face did something complicated. Recognition, relief, and also a flicker of something that looked almost like he was recalibrating a memory, checking a years-old image against the person standing in front of him in scrubs with a supply inventory tablet tucked under her arm. "Callahan," he said. "Ochoa." Her voice was neutral, even. "How long has he been in the field compression?" 67 minutes from initial application. "Tourniquet?" "No TQ. We had enough pressure for controlled management. TQ would have flagged the secondary vessel." She was already walking toward the gurney. "What's his name?" "Commander Garrett Voss, CO of—" "I know who he is," she said. She reached the gurney and looked down at the man. Commander Garrett Voss, who was conscious, she saw immediately, conscious and tracking, his eyes finding hers with the coherent focus of someone who was managing their pain rather than being overwhelmed by it, someone trained to stay present even when their body was loudly suggesting otherwise. "Commander," she said. "Callahan." His voice was rough. "Tell me you still know what you're doing." "Still arguing with people about it," she said. "So probably yes." She turned to the nearest trauma nurse, who happened to be Marcus, who had appeared from nowhere with the instinct of someone who had been working trauma long enough to feel the room change. "Marcus, I need a portable ultrasound. I need a second large-bore IV access on the left antecubital. I need a massive transfusion protocol on standby, and I need the vascular surgical tray opened but not used yet. Marcus didn't hesitate. On it. Wait. Stokes stepped into the space between Nora and the gurney. He was not shouting. He was using the controlled, deliberate tone that had cowed residents and nurses for years. Let me be very clear. This is my department. Clinical management decisions in this hospital are made by the physicians in charge of the case, and right now, that is me. Callahan, you are on supply duty. You can observe, but… Raymond, the voice came from behind him. He turned. Dr. Patricia Nguyen was standing at the edge of the trauma bay entrance, and beside her was a man Nora had not seen arrive, heavy-set, in a dark jacket over a collared shirt, with a lanyard that read, Callaway General Hospital Administration, and below that, his name, Director Thomas Breck. Breck was looking at his phone. He held it up briefly. I just got a call from the Naval Regional Medical Command in Seattle. They've formally requested that the treating clinician for Commander Voss be one Nora Callahan, registered nurse, formerly serving as Navy Medical Specialist First Class with an advanced trauma qualification rating that I… He looked at his phone again, as if confirming. Apparently did not know we had on staff. He lowered the phone. Dr. Stokes, please step back. Stokes's jaw tightened. He did not move immediately. For a moment, he just stood there, and in that moment you could see him calculating, weighing his authority against the specific gravity of a hospital director and a military request and a dying man on a gurney, and slowly, visibly, arriving at the conclusion that the math was not in his favor. He stepped back. Nora was already at the gurney. She pulled on gloves in 2 practiced motions, took the portable ultrasound probe that Marcus handed her without looking up, and placed it against the inner thigh of Commander Voss's leg with the steady, particular confidence of someone who had done this in worse conditions than a trauma bay. In the back of moving vehicles, on hillsides, in the dark, in places where a wrong decision didn't result in a formal review, but in a body bag. The image resolved on the screen. She looked at it for 4 seconds. There it is, she said quietly. Not to the room, almost to herself. Then she looked up. He has a secondary transection of the lateral circumflex femoral artery that the field compression has been partially masking. The primary wound path has tamponated enough to keep him stable, but the secondary vessel is under tension and it's going to let go. She looked at Marcus. Get me a vascular surgeon on the phone right now. I need Dr. Huang if she's available, not anyone else, specifically Huang. And tell her what I just told you. I can manage this until she gets here, but I need her in the OR in under 20 minutes. She glanced at Ochoa. Good call on no tourniquet. TQ would have released the pressure differential, and we'd have lost him in the field. Ochoa nodded once. That's what we figured. Who figured it? A pause. You trained our medic in 2021, he remembered the principle. She didn't say anything to that. She turned back to her patient. Garrett, she said, and the use of his first name was deliberate, clinical, a way of keeping him tethered. I need you to stay with me for the next few minutes. We're going to manage this together until the OR is ready. Can you do that? Commander Garrett Voss, bleeding from a wound that had been 67 minutes in the making, looked up at the woman standing over him with an ultrasound probe and a calmness that the rest of the room was only now beginning to catch up to. You know, he said, when they told me they were taking me to Callaway General, I thought we were done. Yeah? She said, not looking up from the screen. Then Ochoa said you were here. She glanced at him briefly. And? He almost smiled. It was a small thing, barely there, more in his eyes than his face. And I thought we might be okay. She looked back at the ultrasound. The image was telling her exactly what she needed to know. And what she needed to know was that the next 9 minutes were going to require everything she had, and that the secondary vessel was holding, barely, and that Dr. Huang needed to be scrubbed in and ready before it decided to stop holding. Behind her, the trauma bay was reorganizing itself around her without being asked. Marcus had the IV access running. The transfusion protocol was being activated. Ochoa had stepped back and was watching with the flat professional attention of a medic who recognized competence and knew to stay out of its way. Dr. Stokes stood near the entrance to the trauma bay. He was not participating, he was watching. And what he was watching, though he didn't have the word for it yet, though he wasn't ready to give it the word it deserved, was a woman dismantle in approximately 4 minutes the narrative he'd spent 11 weeks constructing about who she was. She had moved through his department like a person choosing to be invisible. She had absorbed his contempt with a stillness that he had mistaken for acceptance. She had restocked his supply carts and documented her concerns and watched his patients while he stood in front of a room and talked about excellence. And now she was standing in his trauma bay, in scrubs, with an ultrasound probe and a phone call from the United States Navy, keeping a special operations commander alive with the particular precision of someone who had been trained in places Raymond Stokes would never go, for reasons Raymond Stokes would never fully understand. He didn't move. He didn't speak. He stood at the edge of the room and watched. And in the corridor outside, through the narrow window at the end of the hall, the rain came down hard against the glass, and the rooftop lights were still glowing from the landing, and a military helicopter sat on the pad above them, and the woman nobody had respected was the only one in the building that anyone trusted right now. The secondary vessel held. For now. But the ultrasound image was already showing Nora something that nobody else in the room could see yet, something she was running calculations on in the back of her mind while her hands stayed steady and her voice stayed calm. A pressure change, subtle, the kind of thing you only recognized if you'd seen it fail before, if you'd been the one holding the compression when the math stopped working. She had been that person. She knew exactly what was coming. And she had maybe 6 minutes to make sure it didn't. 6 minutes was an estimate, and estimates were guesses dressed up in numbers, and Nora had learned a long time ago not to trust them too much. She had learned it in a specific place, at a specific moment, in the back of a vehicle that was moving too fast over terrain that wasn't meant to be driven at any speed, while a man whose name she still remembered, Corpsman Derek Fales, 24 years old, from Billings, Montana, was bleeding from a wound that the textbook said she had 8 minutes to manage. She had managed it in 5. Not because she was exceptional, because she had stopped counting minutes and started counting decisions. She counted decisions now. Decision 1. The current compression position was adequate, but the angle was wrong for what was about to happen. The secondary vessel, the lateral circumflex femoral, sitting deep to the primary wound path, under tension from the tamponade effect of the field dressing, was going to decompress the moment the surrounding tissue pressure shifted, and the surrounding tissue pressure was going to shift the moment Commander Voss's blood volume crossed the threshold that his body could no longer compensate for. His pressure had been holding at 94 systolic for the past 6 minutes. That number was a lie. It was his body making promises it couldn't keep. She repositioned her left hand without looking up from the ultrasound screen. Not dramatically. Just moved it 3 centimeters medial and applied a slightly different vector of pressure that would bridge the gap when the primary tamponade failed. Marcus saw the movement and didn't ask about it. After 9 years in trauma, he had learned that sometimes the best thing you could do for a clinician in the middle of something was stay useful and be quiet. He handed her the second IV line confirmation without being asked, and she registered it with a small nod that meant she'd heard him even though she hadn't looked up. "Huang," she said. 3 minutes out, Marcus said. She was already in the building, post-op consult. "Tell her I need her scrubbed, and at the OR door in 7. Not 8. 7. Got it." The room had reorganized itself in the way that trauma rooms did when someone competent took the center of it. Not loudly, not with announcements, just a quiet realignment, people moving to where they were needed, the atmosphere changing from reactive to purposeful. 2 of the SEAL team's operators had taken up positions near the doorway, not blocking it, not interfering, just present in the way that people who'd spent years in high-stakes environments were present. Attentive, still, aware of every exit and every person in the space between them and their CO. Ochoa stood at the foot of the gurney. He wasn't watching Nora's hands. He was watching Voss's face, the same way a medic watches a patient's face when the hands are already doing what they need to do, and the face is where the truth lives. Voss's face was telling a story. He was conscious, which was good. He was tracking the room, which was better, but there was a particular quality of stillness that was starting to settle over him that Nora recognized and didn't like. The stillness that came not from calm, but from the body quietly redirecting resources. The physiological triage that happened when the system started making hard choices about where the blood needed to go. "Garrett," she said. "Still here," he said. His voice was slower than it had been 4 minutes ago. Tell me something useless. A pause. What? Something useless. A fact. Something you know that doesn't matter right now. She heard Ochoa make a very small sound that might have been something close to a suppressed laugh. It was a technique, and Ochoa knew it was a technique. Keeping a patient's cortex engaged slowed the cascade, kept the autonomic response from spiraling, bought time in ways that were real and measurable, even if they sounded like conversation. Voss was quiet for 3 seconds. The Mongol Empire had better postal infrastructure than most of Europe did 3 centuries later. That's actually interesting, she said. That doesn't count. It's the only useless fact I know, he said. I'm not a useless fact kind of person. Work on that. His blood pressure dropped 4 points. She felt it before she saw it, in the slight change of resistance under her hand, the tissue telling her what the monitor was about to confirm. She adjusted her pressure again, precise, deliberate, and looked at the ultrasound screen and said, very calmly, Marcus, we're going to move in the next 90 seconds. Tell the OR we're not waiting for 7 minutes. We're coming in 5. BP's dropping, the monitoring nurse said from the other side of the gurney. This was a nurse named Yolanda Park, who had been in trauma for 4 years and who had the particular quality of someone who reported numbers without panic, which was the only kind of person Nora wanted in a room like this right now. I know, Nora said. Call it. 88 systolic. Pressure's dropping, Yolanda said again, 30 seconds later. 83. The vessel was letting go. Not catastrophically. Not yet. But the tamponade was failing. The tissue pressure differential that had been keeping the secondary transection from becoming a full hemorrhage was collapsing, and there was a window, a real, physical, countable window, between now and the moment when managed became unmanageable, and that window was closing and Nora had her hand on the only thing standing between those two states. We move now, she said. Ochoa, you're with us. One of your team can come, not both. There's no room. Everyone else stays here. Ochoa didn't ask which one. He pointed at the operator nearest the gurney, and that man moved without a word, falling into the transport formation with the practiced ease of someone who had moved injured people in bad situations before. They moved through the corridor at a speed that wasn't quite running. The gurney wheels loud on the floor, Nora keeping her position and her hand in place, while the rest of the transport team navigated corners and threshold transitions, and the elevator bank at the end of the hall where the car was already being held by a technician who had clearly been told to hold it and had listened. In the elevator, for 11 seconds, Nora was alone with her hands and the monitor and Commander Voss and the quiet that descended when you were between moments, when the last decision had been made and the next one wasn't here yet. Voss looked at her. You could have told them, he said. She didn't pretend not to know what he meant. No, she said. I couldn't. Callahan, it was over, she said, and her voice was flat and honest and not angry. What I did before, it was another life. I wanted to do this right here. I wanted to be this. A supply nurse, he said, and there was something in it that wasn't quite mockery. A nurse, she said. Just a nurse. The elevator doors open. Dr. Linda Huang was standing at the OR entrance in a surgical gown, already gloved, already masked, and the expression visible above her mask was the expression of a surgeon who had been told something that hadn't made sense until right now, when she saw Nora Callahan emerge from an elevator with her hand maintaining compression on a special operations commander's proximal thigh injury with the specific body mechanics of someone who had been trained to do exactly this. Tell me, Huang said. And Nora told her, in the compressed clinical shorthand of someone who'd spent years giving handoffs in environments where you had maybe 45 seconds to transmit everything that mattered. The wound path, the secondary transection, the tamponade failure timeline, the current pressure, the IV access, the transfusion status, the ultrasound findings, the anatomical consideration for surgical approach that would give Huang the best angle without losing the controlled hemorrhage they'd managed to maintain. Huang listened the way good surgeons listened, without interrupting, without nodding performatively, just taking it in and processing. You maintain manual compression for transit? Huang said. From bay to elevator to here. Huang looked at her hands. How's your position? Good enough to transfer if you're ready. I'm ready. The handoff took 4 seconds. Huang's hands replaced Nora's with the precision of two people who both understood exactly what they were handing off and why it mattered. And Nora stepped back, and the OR doors opened, and Commander Garrett Voss disappeared through them on a gurney surrounded by people who were now, finally, fully equipped to finish what Nora had started. The doors closed. Nora stood in the corridor outside the OR. Her gloves were dark with blood. Her hands were steady. Her heart rate was coming down from whatever it had been in the elevator. She hadn't clocked it. She never did. That was a discipline she'd built over years. You didn't monitor yourself during the hard part. You monitored everything else. Ochoa came to stand beside her. He didn't say anything for a moment. Neither did she. You didn't have to do that alone, he said finally. I had Marcus. You know what I mean. She pulled off the gloves and looked for a disposal bin. There was one 6 feet down the corridor. She walked to it and dropped them in. He's in surgery. He's going to be okay. That's the thing that matters. The thing that matters, Ochoa repeated, and his voice had something in it she recognized as frustration. Not at her, or not entirely at her, but at the situation, at the version of the story where Nora Callahan had spent 11 weeks restocking supply carts. Callahan, they had you counting gauze. I know. They were calling you. I heard things on the way in, the nurses talking. Someone called you an overstep risk. That sounds about right. And you just... He stopped. How did you just stay? She looked at him. Ochoa was 36, she estimated, with the face of someone who had seen enough that the details didn't show themselves anymore, just the cumulative weight of them. He had trained under some of the same people she had trained under, in the program that no longer existed under the name it used to have. He understood some things about her that nobody at Callaway General did or would. Because leaving would have been easier, she said, and I was tired of doing the easy thing. He looked at her for a moment. That doesn't make sense. I know, she said. It still doesn't stop being true. They stood there in the corridor while the OR worked, and the storm pushed against the building's windows, and somewhere in the hospital below them, Nora knew the conversation about what had just happened was already beginning. She was right about that. By the time she took the elevator back down to the trauma level, the department had acquired the particular charged atmosphere of a place where something had shifted and nobody was quite sure yet what the new configuration looked like. People were still doing their jobs. The ER didn't stop for internal politics, didn't pause for reckoning, but there was a quality of divided attention, people completing tasks while a portion of their awareness was tuned to the conversation happening in the charge station at the corner of the trauma bay. Dr. Raymond Stokes was at the center of that conversation. He was not shouting. He had the discipline of a man who had learned that quiet authority was more effective than volume, and he was exercising it now with Director Breck, standing in the charge station with the body language of someone who was constructing an argument and was very committed to its architecture. Nora could hear fragments as she walked back toward the bay. Standard credentialing process, and she was credentialed as a registered nurse, not a military request came through official channels. There's a liability question here about what happens when unverified clinical decisions. Raymond? Director Breck's voice was not unkind, but it was very final. The patient is in surgery. He is alive. The Naval Regional Medical Command has filed a formal commendation request for a member of our staff. This conversation is not the conversation you want to be having right now. What I want to be having, Stokes said, is a conversation about the credentialing standards that apparently allowed someone to be hired without anyone verifying that she had. Nobody failed to verify anything, Breck said. Her credentials are on file and they are accurate. What they don't specify, because she requested they not be specified in her public-facing personnel record, is the classified component of her service history, which she was entitled to request. A pause. Classified. That's the word. Stokes was quiet for a moment. Nora had come to stand near the trauma bay entrance, close enough to hear without being part of the conversation, and she watched him process this, watched the argument he'd been building encounter a piece of information it hadn't accounted for, and watched him try to find the accommodation that let him stay in the position he wanted to be in. Regardless, he said, the chain of command in this department is a chain that she followed, Raymond. She documented her concerns, she flagged the charge nurse. She operated within her role until a request was made directly to hospital administration by a military medical command, at which point I authorized her to act. If you have a procedural complaint, file it with me in writing and I will review it. Breck's tone had the specific flatness of a conversation that was ending. Right now, I'd suggest you go back to your department and do your job. Stokes turned. He saw Nora. The distance between them was maybe 20 feet of corridor, and in that distance, something happened that was very small and would not have been visible to anyone who didn't know how to look for it. A fractional change in his expression, some internal recalibration that happened too fast to name before his face settled back into the controlled neutrality he was very practiced at. He didn't say anything. He walked past her and back into the trauma bay. Nora watched him go. Director Breck came to stand beside her. He was a heavy-set man in his late 50s, with reading glasses pushed up on his forehead and the expression of someone who managed crises for a living and was currently in the middle of one that he found more complicated than the kind he usually dealt with. He looked at the dried blood on the cuff of her scrubbed sleeve. "You should probably change," he said. "Probably," she agreed. "How's Voss?" "Huang's good. He'll make it." Breck nodded. He seemed to be considering his next words carefully, which Nora respected. "I owe you an apology," he said. "No, you don't. You didn't hire me. I run the hospital that hired you, and I've seen your—" He paused. "The record they sent from Seattle. The full one." He paused again. "You should not have been in supply." "I was getting things done in supply," she said. "The power levels were genuinely off." He looked at her. "You're not going to make this easy, are you?" "Make what easy?" "The part where I try to acknowledge what happened here tonight." She thought about that. "I don't need it acknowledged," she said. "I need the secondary trauma bay to be properly stocked for the rest of the night shift because I found 3 supply gaps in the inventory, and I wrote them up, but nobody's pulled the orders yet." Breck stared at her for a moment. Then he took out his phone and made a call, and Nora heard him tell someone on the other end to authorize the emergency supply orders for Trauma Bay 2 and to flag the requisition as high priority. "Done," he said. "Thank you," she said. She went to change her scrubs. The waiting was the part nobody told you about. Everyone thought the hard part was the intervention, the hands-on, the decisions, the compressed window where everything was on the line. And that part was hard. But the hard part that came after, the part where you sat outside a surgical suite and had nothing to do but exist in the space between what you'd done and what came next, that part had its own particular weight. Nora sat in a chair at the end of the OR corridor on the 2nd floor. She'd changed into fresh scrubs. She'd gotten coffee from the 3rd-floor vending machine, the bad kind that came in a paper cup and tasted like hot water had been introduced to a coffee bean briefly and without commitment. She held the cup with both hands and looked at the wall across from her and thought about the things she usually tried not to think about. She thought about the day she'd left the program. Not a dramatic departure. No ceremony, no conflict, just a meeting with a woman in a gray office who had reviewed her file and told her she was being honorably discharged after the incident in the field that had ended her deployment status. The incident that had not been her fault, that 2 separate reviews had confirmed had not been her fault, but that had left 4 people dead and Nora standing in a field at dawn with blood on her hands, and a clarity so absolute that it had felt, briefly, like a kind of violence. She had walked out of that gray office and spent 3 months in a town in northern Washington that she didn't know anyone in, and she had studied for her nursing licensing exam, and she had decided that the part of what she'd done that she wanted to keep, the part that had felt true in all of it, regardless of everything else, was the part where she'd helped people not die. That part she could do anywhere. She could do it in a gray hospital with fluorescent lights and bad vending machine coffee. She could do it quietly, without anyone knowing the context she brought to it, and it would still be the same thing it had always been, which was the thing she was good at, the thing that felt like a reason. She was not, she thought, a person who needed to be known. She'd tried it both ways, and she understood herself well enough to know that anonymity was not a wound for her. It was a preference. The name, the record, the classified history. She'd chosen to put all of it in a box. And the box had worked fine for 11 weeks, and the fact that it had come open tonight didn't change the reason she'd closed it. Marcus Webb found her sitting there at 11:43 p.m. He came around the corner with his own paper cup of vending machine coffee, saw her, and stopped. Then he came and sat in the chair next to her with the slightly careful movement of someone who wasn't sure if he was welcome but was showing up anyway. "Huang's still in there," he said. "I know." "You've been up here for—" "I know." He drank his coffee. She drank hers. The corridor was quiet, the specific quiet of a hospital at night when the volume dropped but never went silent. The monitors and ventilators and distant footsteps continuing underneath everything like a low continuous note. "I've worked here 9 years," Marcus said. "I've seen a lot of people in those bays." She didn't respond. "I've seen some good ones," he said. "People who knew what they were doing, people who were calm when it was bad. Dr. Nguyen's actually, when she's focused, she's really good. Hartwell too sometimes." He paused. "But I've never seen someone do what you did tonight." "Ochoa's medic did the hard part," Nora said. 67 minutes in the field, he kept that compression consistent. "I'm not talking about the medic." She looked at her coffee. "I think about the Trisha Lohman case," Marcus said. "The woman with the splenic lac. He put you in supply 3 days after that. And you just went. No complaint, no appeal, just went and started counting gauze." "The gauze needed counting." "Nora." His voice was quiet and direct. "Why didn't you say anything? You could have gone to Breck. You could have gone to anyone." She thought about how to answer that honestly. "Because the point wasn't being right," she said. "The point was the work, and I could still do the work." Counting supplies. "Making sure the bays didn't run short." She shrugged slightly. "Trisha Lohman went home to her family. The D-dimer patient went home. Tonight, Voss goes to recovery. The point is the same every time." Marcus was quiet for a moment. "That is either the most emotionally healthy thing I've ever heard," he said, "or the most completely insane." "Probably both," she said. He almost smiled. It was the first thing close to normal in the last 3 hours, and Nora registered it with a small sense of relief, the relief of recognizing that the people you worked with were still themselves even when everything else had changed. The OR door at the end of the corridor opened. "Doctor." Linda Huang came through it, still in her surgical gown, mask pulled down, her expression carrying the particular fatigue of a successful surgery that had required sustained concentration for a long time. She saw Nora and walked directly to her. "He's out," Huang said. "He's stable. Recovery's going to be significant. We're talking months of rehabilitation on that leg. But the vascular repair is solid. No compromise to the femoral nerve. He'll walk." Nora let out a breath. "The secondary transection," Huang said. "Another 20 minutes and we'd have been in a different conversation." "I know." "The compression you held in transport," Huang paused, and the pause was not nothing. It was Huang deciding something about what she wanted to say. "Where did you learn to do that with one hand and maintain position through transit?" "The program doesn't exist anymore," Nora said. Huang looked at her for a moment. "No," she said. "I don't think it does." She glanced at Marcus, then back at Nora. "Get some sleep. I mean that clinically." "I'm still on shift." "Your shift ended 20 minutes ago." Huang turned and walked back toward the OR to deal with the post-operative orders that were waiting for her. At the door, she paused without turning around. "Good catch, Callahan. On all of it." Then she was gone. Marcus looked at Nora. "You going to be okay?" "I'm fine." "That's not what I asked." She looked at him. He had the face of someone who had been in trauma long enough to know what the hours after a close call did to a person, the particular crash that followed the compression, the way the adrenaline departed and left something raw in its place. He wasn't wrong to ask. She just wasn't sure how to answer it accurately. "I'll be fine," she said. "Eventually." He nodded. "I'll get your bag from the locker room." "You don't have to—" "I know," he said, and got up and left before she could finish the sentence. She sat alone in the corridor. The quiet settled around her again, the hospital's nighttime frequency, and she held her empty paper cup and looked at the OR doors and thought about Commander Garrett Voss, who would wake up in recovery and have a long road ahead of him, and who would walk, and who would owe that fact to a woman he'd trusted in a field in a country that felt very far away from this fluorescent corridor in Oregon. She didn't think that was nothing. It was, in fact, exactly what she'd come here to do. In this hospital, in this city, in these unremarkable scrubs, doing unremarkable things until the moment when they became necessary, and everything she carried made the difference between one outcome and another. She did not think about Dr. Stokes. Not yet. But Stokes was thinking about her. She found that out the next morning, and not in the way she'd expected, and not from the direction she'd anticipated, and by the time she understood what was actually happening, it was already past the point where understanding it made much difference. The shift change at 6 a.m. brought a new set of bodies into the department and a new set of dynamics, and Nora arrived back at the hospital at 5:45 after 4 hours of sleep that had been deep and dreamless in the way that sleep sometimes was after the body had spent everything it had. She had come back for reasons that were partly practical. She'd left some personal items in the supply room, her water bottle and a book and the inventory notes she'd been working on. And partly the same reason she always showed up somewhere slightly before she needed to, which was that she functioned better when she could see the shape of a space before it filled with people. The trauma bay was quiet at that hour. Yolanda was finishing her notes at the monitoring station. 2 residents were doing patient rounds at the far end of the corridor. The charge nurse was tallying the night's cases. Nora went to the supply room and retrieved her things and was about to leave when she heard voices from the corridor that connected to the administrative wing. Dr. Stokes's office was at the end of that corridor, and his door was not entirely closed, and voices carried an early morning quiet more than people always remembered. "The inquiry is standard procedure," Stokes was saying. "Anytime a non-physician performs clinical intervention without explicit attending authorization, she had director authorization," another voice said. It was Dr. Nguyen, Patricia, and she sounded like someone navigating terrain carefully. "Breck authorized it in the moment. Breck isn't a clinician. He can't authorize clinical procedures." "Raymond, the inquiry will establish the procedural record, that's all. It's not punitive." A pause. "It feels punitive. It's procedure." "She saved his life," Nguyen said. "She saved his life with her bare hands in a moving elevator." Which is exactly the kind of unauthorized independent action that creates liability for this institution, Stokes said. "If she had done that, and he had died, we would be in a completely different conversation." But he didn't die. "Patricia, the inquiry is filed. It's done." His voice settled into something very final. "If Callahan's record is as impressive as Breck seems to think, she'll have no trouble demonstrating that she operated within an appropriate scope. But the inquiry exists, and it will run its process." Nora stood in the supply room doorway with her water bottle in one hand and her book in the other. She stood very still. She had known, in the abstract way that people know things they don't fully want to look at, that last night had not resolved anything, that saving a life in the presence of people who had dismissed her was not, in itself, a resolution, that systems built on hierarchy did not restructure themselves because of a single night, no matter how visible. She had known that. She just hadn't expected the filing to happen before 6 a.m. She put her water bottle in her bag. She put her book in her bag. She walked out of the supply room, through the trauma bay, past the charge station where the night charge nurse was finishing handoff notes, and out through the ambulance bay doors into the early morning. The rain had stopped sometime in the night. The air was cold and damp, and smelled like wet concrete and distant evergreens, the particular Calvert City morning smell that she had come to know in 11 weeks without quite being aware of learning it. She stood on the ambulance bay ramp and looked at the sky. Gray, but the kind of gray that had some light behind it, the kind that might actually become morning. Her phone buzzed. She looked at it. The message was from a number she didn't recognize, with an area code that she did. Seattle. "This is Captain Dana Elroy, Naval Regional Medical Command. I have been informed of last night's events. I need to speak with you today. This is not optional. Please call this number at your earliest opportunity." Nora looked at the message for a long moment. She thought about what Ochoa had said in the corridor outside the OR. You could have told them. She thought about what she'd said back. It was over. She thought about the inquiry that was already filed before the sun came up, the machinery of institutional self-protection already moving in a direction that had nothing to do with what had actually happened in that trauma bay last night. She put her phone in her pocket. She looked at the sky again. The light behind the gray was getting stronger, she thought. Not dawn yet. Not quite. But close enough that you could see it was coming. She took out her phone again and called the Seattle number. It rang twice. "Captain Elroy?" said the voice on the other end. "This is Nora Callahan," she said. "I was told you wanted to speak with me." There was a brief pause on the other end, and then Captain Elroy said something that stopped the morning in its tracks. 4 words that landed in the quiet of the ambulance bay ramp and rearranged the shape of everything Nora had assumed the next few days would look like. "We need you back," Elroy said. The silence on the ambulance bay ramp lasted maybe 2 seconds, which was long enough for the words to settle and for Nora to understand that they were not the beginning of a conversation she wanted to have standing outside a hospital at 6 in the morning with wet concrete under her shoes and an institutional inquiry already filed against her inside. "That's not something I can answer right now," she said. "I understand," Elroy said. "I'm not asking for an answer right now. I'm asking for a conversation. Today, if possible. I'm dealing with something here. I know about the inquiry." A pause. Commander Voss's team filed an incident report at 0300. It included the sequence of events from arrival to OR handoff. That report went to my desk at 0430. Another pause, shorter. The inquiry Stokes filed went to the hospital board at 0515. I have both documents open right now. Nora looked at the lightening sky. "Then you know more about my morning than I do. I know that a man who would have bled out in a civilian trauma bay is in recovery because of decisions you made under pressure with inadequate resources and no institutional support," Elroy said. "And I know that the person who created those conditions for you is now using administrative process to manage what that looks like for him." Her voice was not loud. It had the particular authority of someone who had spent years saying things that needed to be heard over the noise of difficult situations. "That's not new information to me, Callahan. I've seen this specific situation before. The specifics change. The shape doesn't." "With respect, Captain," Nora said, "I'm not calling you back to be recruited." "I know why you left," Elroy said. "I read the review, both of them." That landed differently than Nora expected. She'd assumed the call was about Voss, about last night, about the Navy wanting to leverage what had happened into something useful for them. The reference to the reviews changed the geometry of the conversation, made it personal in a way she hadn't prepared for on 4 hours of sleep standing on a wet ramp. "Then you know I'm not the right answer to whatever problem you're trying to solve," Nora said. "I'm not trying to solve a problem," Elroy said. "I'm trying to have a conversation, today. In person or by secure video. Your preference." A beat. 1100 hours. Nora didn't say yes. She also didn't say no, which Elroy, she suspected, was experienced enough to correctly interpret. "I'll send the connection details," Elroy said. "Thank you for calling back." The line went dead. Nora stood on the ramp for another minute. The sky was definitely getting lighter. Not warm light. Oregon in November didn't do warm morning light. It did gray that slowly graduated into less gray. But there was enough of it now to see the parking structure across the ambulance bay clearly. The wet gloss of the concrete levels. A crow sitting on the railing of the second deck looking at her with the particular blankness of a bird that had no opinion about any of this. She went back inside. The inquiry notification arrived in her hospital email at 7:52 a.m. in the form of a formal letter from the Callaway General Risk Management Office, signed by the Risk Management Director, a woman named Phyllis Garrett, whom Nora had never met, requesting Nora's attendance at a preliminary review meeting scheduled for the following Wednesday at 2 p.m. The letter used language that was carefully neutral, review of clinical scope and authorization protocols as related to the events of November 14th, in the way that neutral language was specifically chosen to feel less alarming than the thing it was describing. Nora read it twice, forwarded it to her personal email, and went back to work. She had been reassigned to the trauma bay for the morning shift. She did not know who had made that decision, whether it was Breck acting on something, or the charge nurse following a schedule that had been altered overnight, or some other administrative current she couldn't see. It didn't matter. The bay needed nurses. She was a nurse. She tied back her hair and checked her trauma bay supply levels. Genuinely checked them because the gap she'd identified yesterday was still there, and started her shift. Dr. Stokes arrived at 8:15. He came through the trauma bay with the particular deliberate normalcy of a person who had decided to be very professional about something. He reviewed the overnight census, spoke to the attending physicians, checked 2 patient charts. He did not acknowledge Nora. Not with hostility, not with anything. He moved through the space as if she occupied a category he was currently choosing not to perceive. She had known people who operated this way. It was a strategy, not unsophisticated. Doctor, Wynne found Nora at the medication station at 8:45. I want you to know, Wynne said quietly, that I told him it was a mistake. Nora looked up from the medication reconciliation she was doing. The inquiry. Yes. What did he say? Wynne's expression did something complicated. That it was procedure. That procedure protected everyone, including me. She paused. Which is technically true, which is the part that makes it hard to argue with. You don't need to argue with it on my behalf, Nora said. He transferred you to supply over a splenic lac that you caught before any of us did, Nguyen said. I know about the D-dimer patient too. Hartwell told me. I should have said something then. Nora looked at her, really looked, the way she looked at patients when she wanted to understand what was happening underneath the surface. Nguyen was a good doctor, genuinely good, technically precise, with clinical instincts that would have served her well in environments more demanding than this one. She was also someone who had learned to function inside a system that rewarded a specific kind of accommodation, and that accommodation had become habitual in the way that adaptations always eventually did. You're saying something now, Nora said. Nguyen nodded. For what it's worth. It's worth something, Nora said. She meant it. Nguyen left, and Nora went back to her medication reconciliation, and the morning moved forward in the rhythmic way that hospital mornings moved. A steady current of cases, assessments, interventions, documentation, the work that was the actual substance of the place underneath the politics. The work that continued regardless of inquiry filings and administrative maneuvering and whatever Captain Elroy in Seattle wanted to discuss at 1100 hours. At 9:20, Marcus appeared at her elbow with the expression of someone who had learned something and was trying to decide if it was his place to say it. Say it, Nora said, without looking up. How do you do that? You have a tell. What did you find out? He lowered his voice. The inquiry isn't just about last night. I heard Phyllis Garrett talking to someone in the administrative corridor. They're pulling your full personnel file, every documented interaction, every incident note. The Lohman case, Nora said, and the D-dimer catch. And apparently there's a note in the file from your second week, something about a medication question you raised that the attending overruled. Nora remembered that. A patient on a blood pressure medication protocol whose weight had changed significantly since the dosing was calculated. She'd flagged it. The attending had said the dosing was per protocol. She'd documented her concern, and the patient had been fine. It had felt like a non-event. They're building a pattern, Marcus said. Repeated unauthorized clinical input. That's the framing. Nora set down her pen. She looked at the wall across from the medication station. There was a whiteboard there with patient bay assignments on it, names in dry erase marker, the functional geography of the current census. She looked at it without reading it. How many of those cases had good outcomes? She asked. All of them, Marcus said. Obviously. Then the pattern they're building, she said, is a pattern of a nurse who was right. Nora, I know, she said. I know that's not how the inquiry frames it. I know what the framing is. She picked her pen back up. I'm not worried about the inquiry, Marcus. Maybe you should be. Maybe, she said, but I've been evaluated by people with a lot more authority than Phyllis Garrett in situations considerably less comfortable than a Wednesday afternoon review meeting. I know what my record says. She went back to her documentation. Have you done the supply check on Bay 2? He stared at her. You're doing it again. Doing what? The thing where you redirect to logistics when the conversation is about you. Bay 2 was short on chest tube trays yesterday, she said. That's not a logistics redirect. That's a patient safety issue. She looked up at him. Please check Bay 2. He went to check Bay 2. She finished the medication reconciliation and did not think about the inquiry, or not very much, or not in the way that would have consumed her. She had learned, over years, to distinguish between things that required her attention and things that required her patience. And those were not the same category even when they looked like it. The inquiry required her patience. The morning required her attention. She gave each what it needed. At 10:45, she found an empty conference room on the second floor and set up her laptop for the 1100 video call. The room smelled like old coffee and dry erase markers. There was a plant on the windowsill that was either very hardy or plastic, and the light through the window was the particular flat November gray that made everything look slightly overexposed. Captain Dana Elroy appeared on the screen at exactly 1100. She was in her early 50s, with close-cropped gray hair and a face that had been weathered into something that looked more like resolution than age. She wore her uniform, which Nora had expected, and she had a file open in front of her on her desk, which Nora had also expected. "Callahan," she said. "Captain." "How's your morning been?" "Eventful," Nora said. "You're aware of the inquiry?" "I'm aware. I want you to know that the command is preparing a formal response to the hospital board. It will include Commander Voss's incident report and the field team's assessment of last night's intervention. It will also include a summary of your classified service record, declassified to the extent permissible for this purpose, which will make it very clear to the board what clinical authority and experiential background you are operating from." Elroy paused. "Stokes's inquiry will not survive contact with that document." "I appreciate that," Nora said. "That's not what I thought this call was about." "It's not. It's ancillary." Elroy looked at her directly through the screen. "What the call is about is a request, not an order. You're a civilian. I don't have the authority to order you, and I wouldn't if I did. A request." Nora waited. "We're stood up a new program," Elroy said. "Hybrid clinical support for special operations units in domestic transition, operators coming off deployment, complex injury management, the medical gap that opens up between field care and standard VA resources. It's real, it's funded, it's staffed with good people, and it has a significant component that requires someone with your specific combination of experience. Field trauma background, civilian clinical practice, the ability to navigate both environments." She paused. "We've been looking for the right person for 8 months. Last night demonstrated fairly conclusively that the right person has been counting gauze in Oregon." Nora sat with that for a moment. "I left for a reason," she said. "I know the reason. The reason wasn't temporary." "I know that too." Elroy leaned forward slightly. "I'm not asking you to go back to the field. The program is Seattle-based. Clinical facility, standard hours, some travel for assessment work, but nothing deployed. It's Callahan. It's a desk with your name on it, and a patient population that you are specifically qualified to serve, and it currently doesn't have the right person in it." Nora looked at the window. The gray light was doing the same thing it did all morning, which was remain gray. "I need to think about it," she said. "I know. That's the right answer. I didn't expect yes right now." Elroy closed the file in front of her. "Think about it. Talk to whoever you talk to. I'll be available when you're ready." She paused. "One more thing." "What?" "Commander Voss wanted me to pass something along." Nora looked back at the screen. "He's conscious?" "Woke up at 08:30, slightly combative about the pain medication, very much himself." Something in Elroy's expression was almost, not quite, a smile. "He said to tell you that he's been thinking about useless facts." Nora was quiet for a moment. Then, despite herself, despite the inquiry and the morning and the weight of the conversation she'd just been in, "Did he come up with one?" "He said the blue whale's heart is large enough for a person to crawl through its aorta," Elroy said. "He thought that was appropriately useless." "That's actually fascinating," Nora said. "He figured you'd say that." The call ended. Nora sat in the empty conference room for 3 minutes, looking at the gray window, the maybe plastic plant, the residue of other people's meetings on the whiteboard that someone had erased imperfectly, and that still showed ghost traces of whatever had been urgent enough to map out in here at some point. She didn't have an answer for Elroy. She wasn't sure she'd have one quickly. What she did have was a 1:30 trauma shift in a Bay 2 supply situation and a Wednesday review meeting to prepare for, and those were the things in front of her, so she closed her laptop and went back to work. She did not expect the afternoon to accelerate the way it did. The first signal came at 1:15 when she was back in the trauma bay, and a case came in that was, on paper, routine. A 61-year-old male with a history of hypertension, presenting with acute chest pain onset, triage flagging possible cardiac event, the kind of case that the ER ran multiple times a week with a well-established protocol. The attending was Dr. Hartwell. He moved the patient to Bay 3, ran the EKG, reviewed the findings, and was building toward a STEMI management protocol with the efficient certainty of someone who'd done this case before. Nora was the Bay nurse. She looked at the EKG. She looked at the patient, a man named Bernard Solis, who was 61 and barrel-chested and had the color of someone in significant distress, and who was also doing something with his left arm that wasn't the referred pain pattern she expected, and whose EKG had a finding in lead AVR that she looked at for 3 seconds and then looked at Hartwell. "I want to call this a STEMI," she said, "but look at lead AVR." Hartwell glanced up. "Diffuse ST depression with AVR elevation, classic ischemia pattern." "It's diffuse," she said. "All leads. That's not typical single vessel." He looked at the EKG again, longer this time. "You're thinking left main, or proximal LAD, but the distribution, I see it." His voice was careful now, recalibrated. "I see it. Get cardiology on the phone. We need to escalate this to the cath lab." She was already reaching for the phone. Left main coronary artery disease, occlusion or critical stenosis of the vessel that supplied blood to the majority of the left ventricle, was a different emergency than a standard STEMI, more diffuse, higher mortality, requiring a different and faster intervention pathway. The EKG finding was subtle, the kind of thing that could be read as severe STEMI and treated wrong. And treated wrong meant the patient going to the wrong intervention at the wrong speed. Hartwell made the cardiology call himself. 6 minutes later, Bernard Solis was being transferred to the cardiac catheterization lab on a pathway that the cardiology fellow described, when she arrived, as exactly right. Hartwell did not take credit for the EKG read in front of the fellow. He said, "My Bay nurse flagged the AVR pattern." The cardiology fellow looked at Nora briefly, with the particular evaluative look of someone updating a category, and then turned back to the patient. Nora finished her documentation and moved to the next case. She did not think about the moment. She was already inside the next thing. What she didn't know, because she wasn't in the administrative corridor at 2 p.m. when it happened, was that Hartwell walked directly from that bay to Thomas Breck's office and told him what had happened, and then told him about the D-dimer patient, and then said something that he hadn't been willing to say when it might have cost him something, that the Lohmann splenic lac had been flagged by Callahan 40 minutes before the ultrasound confirmed it, and that Stokes had known that and hadn't included it in his debrief. Breck listened to all of it. Then he made 3 phone calls. The second one was to the risk management office. The inquiry meeting, he said, needed to be suspended pending additional administrative review. Phyllis Garrett asked him to clarify the grounds. He told her to add Hartwell's statement to the file and review the clinical outcomes associated with every notation in Callahan's personnel record. The third phone call was to the hospital board chair. Nora found out about the Hartwell statement from Marcus at 4 p.m., who had heard it from the charge nurse, who had heard it from someone in the administrative corridor who'd been there for the start of the conversation. She processed the information without visible reaction, which by this point Marcus had learned to read not as coldness, but as a kind of settling, the way a person looked when something that had been unresolved was beginning to resolve, and they were trying not to assume what the resolution would be. "Hartwell did that," she said. "Apparently. On his own." On his own. She thought about that, about what it cost a person to say something that reframed a story they'd been part of, that required acknowledging what they'd let pass. It wasn't nothing. She wasn't going to pretend it was nothing. "Is he still in the building?" she said. "I think he's doing rounds." She found Hartwell in the second-floor corridor outside the patient rooms, reviewing a chart. He looked up when she approached with the expression of someone who was prepared for several different kinds of response. "Thank you," she said. He nodded. I should have done it earlier. Yes, she agreed. But you did it. He looked at the chart in his hands. I've been a doctor for 20 years, he said, and I still learned something from an EKG read today. That seems like information I should have had access to a long time ago. She didn't say anything to that. There wasn't anything useful to add. She went back to her shift. The fracture, the real one, the one that changed the shape of everything, happened at 6:17 p.m. It didn't announce itself. It arrived the way serious things often arrived in hospitals, sideways, from a direction nobody was watching. A woman came into the ER through the ambulance bay. Mid-40s, white, brought in by a private vehicle rather than an ambulance, which was itself a data point. Her name, according to the ID in her wallet, was Renata Moss. She was conscious, communicating in fragments, with the specific combination of symptoms that could have been a dozen things, and was rapidly narrowing toward a short list. The triage nurse flagged it as altered mental status with headache and vomiting, possible intracranial event. The attending on coverage at that hour was a hospitalist named Dr. Frank Asher, a competent general physician with limited emergency subspecialty experience who had been pulled to ER coverage because the evening's trauma attending had called out sick. Asher assessed her. He was thinking meningitis. The headache, the vomiting, the slight light sensitivity, the low-grade fever that had appeared on the temperature check. It was a reasonable clinical hypothesis. Nora was doing end-of-shift handoff preparation at the nurse's station when the triage nurse brought the intake sheet to the charge desk, and she glanced at it the way she glanced at everything, not intending to intervene, not looking for something. Just the habitual information processing of someone whose nervous system had been calibrated over years to flag things that didn't fit. Something didn't fit. She walked to Bay 4. Renata Moss was lying on the gurney with her eyes partially closed, answering Dr. Asher's questions in single words or not at all. The light sensitivity was real. She turned her face away when Asher moved the exam light toward her. Her neck had mild stiffness on Koenig testing. Meningitis was on the list. But Nora looked at the woman's face. The asymmetry was subtle, barely there, the kind of thing you missed if you were looking at a list of symptoms rather than a person. The left nasolabial fold slightly less pronounced than the right, the left eyelid at a half-millimeter lower position. "Dr. Asher," she said, "can I show you something?" He looked up. He didn't know her well. She'd worked with him only twice before, but he was not Stokes. He didn't have the specific architecture of ego that required him to refuse. "What?" he said. "Look at her face. Left side." She kept her voice level. "And her hand position. The left hand is pronated." He looked. She watched him look and watched the moment when he saw it. "Pronator drift?" he said. "I think so. I think this may be subarachnoid hemorrhage presenting with meningeal signs. The headache onset is..." Did she describe it at triage? Asher looked at the intake form. "Sudden severe." "Thunderclap," Nora said. "That's thunderclap onset, not meningitis." Asher stood very still for about 4 seconds. In those 4 seconds, he was doing what good physicians did when a clinical picture suddenly shifted, rapidly recalculating, checking the new model against the evidence, deciding if the revision held. "CT head," he said. "Stat, and get neurosurgery on the phone." "Lumbar puncture?" the intake nurse asked. "Not until after the CT," Nora said, and Asher echoed it immediately. "Not until after CT, because LP before CT and a possible intracranial hemorrhage could cause herniation, could kill her, and the order of operations was not negotiable." Renata Moss went to CT imaging in 7 minutes. The scan came back in 15. Subarachnoid hemorrhage, blood in the subarachnoid space at the base of the brain, consistent with an aneurysmal rupture, the kind of event that had a 30% mortality rate in the first 24 hours, and that required neurosurgical intervention within a window that was already partially spent. Asher called neurosurgery directly. The on-call neurosurgeon, a man named Dr. Callum West, was in the building doing a post-operative check and arrived in Bay 4 in 9 minutes. He looked at the CT. He looked at the patient. He looked at the intake documentation. "Who caught the thunderclap history?" he said. Triage documented sudden severe headache, Asher said. My bay nurse flagged the presentation pattern. Wes looked at Nora. She was finishing the transfer documentation so Renata Moss could go to the neurosurgery suite. Good catch, Wes said. She needs to go now, Nora said. The window is… I know the window, he said. We're going. They went. Nora stood at the Bay 4 entrance and watched the gurney move down the corridor and through the doors at the far end, and she felt the particular aftermath of a near miss. Not relief, not exactly, because relief required certainty and Renata Moss wasn't out of the woods yet. Not close. Just the specific held quality of someone who had made a decision and was now waiting to find out if it was the right one. Behind her, someone started clapping. Just one person at first. Then a second. Then the sound spread through the trauma bay. Nurses, techs, the hospitalist covering the other bays. A slow building recognition that was not theatrical, not performative, just people in a department acknowledging something they had seen. Nora turned around. She was not a person who received recognition comfortably. She had never built the reflex for it. She stood at the entrance to Bay 4 with a transfer clipboard in one hand and looked at the people looking at her. And something in her face did an unguarded thing. Not embarrassment, not dismissal, just a brief visibility, a moment of being seen that she hadn't prepared for and couldn't quite armor against. Dr. Stokes was standing at the edge of the trauma bay. He had come down from wherever he'd been, drawn by the same current that drew people when something significant was happening in a department, and he was standing at the edge of the space and watching. And on his face was an expression that Nora had not seen from him before. Not hostile, not controlled, not performing authority. He looked like a man doing a calculation that was coming out differently than all his previous calculations had, and not knowing yet what to do with the difference. He looked at her for a long moment. Then he looked away. Nora set the transfer clipboard on the charge desk and went to find Asher to complete the handoff documentation because the shift was ending and the work still needed to be finished, and Renata Moss needed her record complete and accurate before the next team came on. She was almost at the documentation station when her phone buzzed. She looked at it. It was a message from Director Breck. My office. Tomorrow morning, 8 a.m. I want to discuss your position in this department. Not the inquiry. Your position. She read it twice. She put her phone away. She sat down at the documentation station and opened the transfer record and began typing, and she was 3 lines into the objective clinical documentation when the charge nurse appeared at her elbow with an expression that had crossed over from professional into something more human. There's someone here, the charge nurse said. In the family waiting area. He's asking for you. Nora kept typing. Who? He didn't give a full name, the charge nurse said. He said… She paused, consulting whatever the person had actually told her. He said to tell you it's Stokes, Raymond Stokes, and that he's not here as department chief. Nora's hand stopped on the keyboard. She stared at the screen. He said he's here as the person who owes you an explanation, the charge nurse continued, and that he'll wait as long as it takes. Nora sat very still. The documentation cursor blinked on the screen in front of her, waiting. Down the corridor, through 2 sets of doors, in a room with uncomfortable chairs and a television mounted too high on the wall, Raymond Stokes, who had transferred her to supply, who had filed an inquiry before the sun came up, who had spent 11 weeks treating her like furniture, was sitting in a family waiting room asking to speak to her. She thought about what Marcus had said that morning. That is either the most emotionally healthy thing I've ever heard, or the most completely insane. She looked at the blinking cursor. She saved the document. She stood up. And before she could take a step toward the waiting room, her phone rang. Not a text, a call, the Naval Regional Medical Command area code, but not Elroy's direct line. A different number. And when she answered it, the voice on the other end was not Elroy. It was Ochoa. And his voice had a quality she recognized from the field, the compressed efficiency of someone transmitting information that had no time to be framed carefully. Callahan, he said, we have a problem. She stopped walking. What kind of problem? She said. The kind that involves you specifically, Ochoa said. One of our guys. He was in the field with Voss. He came in on his own. No team support. We don't know where he is. We know he's in Calvert City, and we know from his last contact that he's in medical distress. And he said one thing before he went dark. What did he say? He said he needed Callahan, Ochoa said. He said, find Callahan. Those were the last words anyone got from him, and that was 40 minutes ago, and we have a location radius of about 6 blocks from your hospital, and Nora, his voice, steady through everything she'd known him through, cracked on her name. He's going to die if we don't find him in the next 30 minutes, Ochoa said. 6 blocks, Nora said. Give me the last known coordinates. Ochoa read them out. She was already moving. Not running, not yet, but walking with the pace of someone who had calculated the distance and was closing it. She pushed through the trauma bay doors into the ambulance corridor, phone to her ear, her mind running the problem the way she ran every problem, which was forward, sequentially, without spending energy on the parts she couldn't control. What do you know about his condition? She said. His name is Petty Officer Second Class Aaron Tully, 26 years old. He was in the field with Voss's team, took secondary fragmentation to the lateral torso during the same engagement. Field assessment said superficial. He was ambulatory. He refused evacuation. He helped get Voss to the helicopter and then got separated from the team during the extraction confusion. A pause. When we did the head count at the hospital last night, he wasn't there. We thought he'd gone to ground somewhere to decompress. That happens. We gave him until this morning. And this morning he wasn't reachable. We ran a locate on his last phone ping at... Wait. She heard him moving, the sound of a door, wind. He's been stationary for 42 minutes. The location isn't moving. He's down, Nora said. Yeah. Does he have any field kit on him? He had a blowout kit when he left the extraction point. We don't know what he used and what he has left. She pushed through the ambulance bay doors into the cold evening air. The sky was dark now, fully dark, the gray of the afternoon having graduated into a black that was low and close and wet. The streets around Callaway General were the specific urban texture of a hospital neighborhood. Parking structures, a pharmacy, a coffee place that had closed 2 hours ago, the odd geography of a block that existed to serve a building. Send me the exact coordinates, she said. Right now. Her phone buzzed with the location pin. She looked at it. The pin was 4 blocks northeast, on a street called Dunmore, which she knew from her daily commute as a block of older commercial buildings, some of them converted to mixed use, with a parking structure on the south end and an alley that ran behind the businesses on the east side. She turned northeast and started moving faster. I need you to call the ER charge desk at Callaway General, she said to Ochoa. Extension 472. Tell them Callahan is requesting a mobile trauma response. 1 nurse, 1 tech, gurney with IV supplies, and a trauma kit. Tell them to bring it to the corner of Dunmore and Reyes in 3 minutes. Can they do that? I don't know, she said honestly, but ask. She hung up and broke into a run. She had done this before, not in Oregon, not in a hospital neighborhood, but the physical logic was the same. The translation of known information into movement, the body doing the thing the mind had already resolved. She was wearing scrubs and soft-soled shoes designed for 12-hour shifts, not for running 4 blocks on wet pavement, and she was aware of that in the way you were aware of things that didn't change the math, acknowledged and set aside. Dunmore Street came into view at the end of the block. She turned the corner and slowed, scanning. The street was partially lit. Old sodium lights, one of them flickering, the commercial businesses dark at this hour. The parking structure to her left. The alley entrance to her right. She went for the alley. It was the logic of a person who needed to be out of sight, who was injured and moving on instinct and looking for cover without quite knowing why. You didn't go into an open street, you went for the darker and more sheltered space, the one that felt like protection even when it offered none. She was 12 steps into the alley when she saw him. He was sitting against the brick wall on the left side, his legs extended in front of him, his head back against the wall in the position of someone who had sat down to rest and hadn't been able to get back up. He was in civilian clothes, dark jacket, jeans, and the dark jacket was doing what dark jackets did, which was hide color. But Nora could see the way he was holding his left arm slightly elevated and braced against his body, and she could see in the sodium light that spilled from the street that the jacket on his left side was wet in a way that had nothing to do with rain. "Tully," she said. His head came up. His eyes found her, and in the finding of her there was a quality that she recognized. The specific relief of someone who had been alone with a bad problem for too long and had just stopped being alone. "You're Callahan," he said. His voice was rough and slower than it should have been. "I'm Callahan." She was already crouching beside him, her hands going to the jacket, assessment before anything else. "I need to look at the injury." "It's fine." Tully. "It was superficial. The field assessment said, the field assessment was done in the dark during an active extraction," she said. "Let me look." He shifted his arm, and she opened the jacket, and what she found was not superficial, had never been superficial, had probably looked superficial in the field because the fragmentation wound was small, maybe a centimeter of entry, but the location was wrong, too far posterior, too close to the lateral chest wall. And the wetness was not all blood, or not only blood. And when she put her hand against his chest and asked him to breathe, she could feel the asymmetry of it before he told her. "Breathing's been a little off," he said. "Since this morning." "Since this morning," she repeated. She kept her voice even. "Aaron, have you been moving around today?" "Some." "Exerting yourself?" He looked at her. "I helped load Voss onto the helicopter. I walked a lot after." A small penetrating wound to the lateral chest. Activity. Time. The pneumothorax that had started as a small breach in the pleura, the lungs lining, and had been aggravating itself slowly with every breath and every exertion over the past 22 hours. The lung on his left side progressively less able to expand. The air accumulating in the chest cavity with nowhere to go. "Is it tension?" she said, more to herself than him. His trachea was midline still, barely, and his blood pressure, she pressed 2 fingers to his radial pulse, counting, was fast and thready, his neck veins not yet visibly distended in the low light, but the respiratory rate, when she counted it, was 26, too fast, compensating for decreasing lung volume. Not tension, not yet, but close enough that the difference was minutes. "You have a pneumothorax," she said. "Your lung has been partially collapsing since yesterday." "That explains some things," he said. His voice was still trying to be wry, which meant his brain was still perfusing adequately, which was the most useful piece of information she had right now. "I need to decompress it," she said. "I need to know what's in your blowout kit." "Jacket right pocket." She reached into his jacket pocket and found the kit, a flat black pouch, the standard field configuration, and she unzipped it and inventoried the contents in about 4 seconds. Tourniquet, chest seals, pressure bandage, nasopharyngeal airway, gloves, a 14-gauge needle decompression kit, still sealed, still sterile. 14-gauge needle decompression. The field intervention for tension pneumothorax BIA, a large bore needle inserted at the second intercostal space, mid-clavicular line, to release the trapped air before it fatally compressed the heart. She was a registered nurse. In a hospital, under a physician's orders, she had the authority to perform this procedure. Standing in an alley in Calvert City, Oregon, with no physician present, no hospital authorization, no attending countersignature, she had exactly the authority that the moment gave her, which was the authority of a woman with a needle decompression kit and a man who was going to die if she waited for the right paperwork. She had been in this calculation before. She put on the gloves. "This is going to be uncomfortable," she said. "Everything's been uncomfortable," Tully said. "Go ahead." She found the landmark, second rib space, just lateral to the mid-clavicular line, her fingers reading the anatomy through his shirt with the certainty of someone who had done this on patients who were not in favorable positions, in conditions less controlled than this one. She tore the seal on the needle kit, checked the catheter, and inserted it with a single controlled movement. The hiss of air was immediate and audible. Tully's next breath was bigger than the one before it. "Yeah," he said quietly. "Yeah, that's... Don't move," she said. "Stay still." She kept the catheter in position, one hand, while with the other, she reached for the chest seal in the kit, the flutter valve type, designed to let air out and prevent it returning, and applied it to the entry wound on his lateral chest with enough pressure to hold. His breathing changed. Not instantly. The lung needed time to re-expand, needed the negative pressure gradient to do its work, and she could feel against her hand the slow inflation of what had been partially collapsed, the chest wall rising more symmetrically now. His heart rate, under her fingers, came down 6 beats per minute over the next 90 seconds. Not resolved, not safe. But he was no longer on the fast deterioration curve he'd been on when she'd found him. She heard footsteps at the alley entrance. Marcus, in a jacket thrown over his scrubs, pushing a gurney at a speed that a gurney was not typically pushed. Behind him was a trauma tech named Rios, who Nora had worked with twice and trusted. The gurney had an IV pole with a saline bag already spiked and a trauma kit bag on the seat. Marcus reached her in 4 seconds and looked at the decompression in place and the chest seal and the patient, and his assessment was visible and fast and professional. "Pneumo," he said. 22 hours, she said. "Near tension. I've decompressed. He needs secondary seal confirmation and IV access and transport." "BP?" Radial pulse was 87 by manual palpation before the decompression. "It'll be climbing."
"Mas horas."
Marcus handed the IV supplies to Rios and went for the patient himself because Marcus had the hands for access in low light and field conditions. 9 years of trauma giving him the tactile efficiency that you couldn't teach in a classroom. "Hey," Tully said to Marcus. "Hey," Marcus said. "Hold your arm out for me." "Are you a nurse?" "Yeah." "There are a lot of nurses here," Tully said. He was talking too much, which was a sign of improving perfusion and also of someone who had been alone in an alley for an indeterminate amount of time and was now in the specific social anxiety of someone receiving help from strangers. "Nora generates a lot of nurses," Marcus said, getting the IV catheter in cleanly. "Hold still." They moved him out of the alley and onto the gurney in 2 minutes. Nora kept the decompression catheter in place during the transfer, one hand on his chest the whole time, because the catheter position was everything, and the catheter coming out of position would immediately restart the problem. The transport back to the ER took less than 4 minutes at a speed that was not exactly a run, but was not a walk. At the ER entrance, the charge nurse was already holding the door. Behind her, visible through the glass of the trauma bay, Dr. Frank Asher was waiting with an expression that said Ochoa had made the phone call and that Asher had decided to be the attending who was present when they came in. "Pneumothorax," Nora said as they pushed through. "Penetrating wound, lateral chest, approximately 22 hours with activity. I perform needle decompression in the field, flutter seal in place, IV access established. He's been talking since I found him." "Got it." Asher was already moving alongside. "Asher Geese. Chest x-ray first, then we'll see if we need a tube." "He's going to need a chest tube," Nora said. "Let's see the x-ray." "Asher," she said, with a patience that was very thin at its edges. "He's been on a partial pneumo for 22 hours and exerting himself. He's going to need a tube." Asher looked at her for a moment. Then, "I'll have the tray opened." They did the x-ray. He needed a chest tube. No. While Asher placed the tube and Rios ran monitoring and Marcus documented, Nora stepped out of Bay 4 and stood in the corridor and let her hand stop for the first time in 40 minutes. They were steady. They were always steady during the work. After was a different matter. After was when the hand sometimes decided to have the reaction that they'd deferred, and she stood in the corridor and breathed deliberately and waited to find out what her body was going to do. It didn't do very much. A slight shakiness in her fingers that lasted maybe 30 seconds, and then it passed, and she was left with the baseline tiredness of a person who had been awake for most of a very long day and had performed emergency procedures in an alley on her off shift. Ochoa came through the ER doors at that moment, still in his jacket, his face carrying the expression of a man who had spent 40 minutes unable to do anything and was now in the reaction to that. He looked at her. "He's in Bay 4, she said. "He's going to be fine. He needs a chest tube and overnight monitoring, and he'll probably give you a hard time about the monitoring." Ochoa let out a breath. Long, controlled, the breath of someone releasing something they'd been holding for a specific amount of time. Where was he? Dunmore Alley, he went to ground on instinct. "The field assessment was wrong," she said. "Small penetrating wound, lateral chest, looked superficial, wasn't. With activity over 22 hours, it developed into a near-tension pneumo. He got lucky with the timeline." She paused. Your team needs a post-extraction protocol for secondary injury assessment. The assumption that ambulatory means uninjured is what left him in that alley. Ochoa nodded. Not defensive. Just nodded. I'll write it up, she said, for the Naval Medical Command request. If you're all going to keep having Elroy call me, I might as well make it useful. Ochoa looked at her. Does that mean you're considering it? She didn't answer the question directly. Go see your guy, she said. He went. She turned around and walked directly into Thomas Breck, who had come down from the administrative level and was standing in the corridor with his jacket open and his reading glasses, as usual, pushed up on his forehead. I heard there was a field response, he said. There was. Unauthorized field response. Technically. Of the needle decompression in an alley variety. He would have been in tension within 10 minutes, she said. There's a calculation that either goes my way or it doesn't, and in this one it went my way, and he's in Bay 4 getting a chest tube. Breck looked at her with the expression of a man managing several converging lines of obligation simultaneously. You're going to give me a heart attack, he said. You're in a hospital, she said. Good place for it. Something in his face shifted. Not quite a smile, but the predecessor of one. The muscular movement that happened before a person decided whether to commit. My office tomorrow, he said. 8 a.m., please. I'll be there, she said. He walked away. She turned back to the bay. What happened next happened in the space of the following 48 hours, and it did not happen the way Nora had expected, which was quietly and in procedural language, but loudly, and with the specific visibility of an institution that had been caught doing something it couldn't defend and was now rearranging itself as fast as it could. The 8 a.m. meeting with Breck was not the meeting she'd anticipated. She arrived at his office to find that it was not, in fact, a one-on-one. Seated across the conference table from Breck were two people she didn't recognize, a woman in a dark blazer who introduced herself as Renee Farkas, from the Callaway General Board of Directors, and a man named Gerald Osei, who said he was outside counsel for the hospital. Phyllis Garrett from Risk Management was also there, and Dr. Raymond Stokes was there, sitting at the far end of the table with a posture that was controlled and careful, and his hands folded on the table in front of him, and an expression that was the expression of a person who had spent the night understanding that a situation had moved beyond his ability to manage it. Nora sat down. Breck opened the meeting by placing two documents on the table. The first was the inquiry Stokes had filed. The second was a compiled record that ran to 31 pages, which Breck identified as a complete clinical outcomes review of every case in Nora's Callaway General personnel file. Every patient interaction she had documented, every concern she had flagged, every outcome associated with those flags, cross-referenced with the responses of the attending physicians who had been present. The outcomes review was completed last night, Breck said. I asked the Quality Assurance Department to run it on an emergency basis. He looked around the table. What it shows is that Nurse Callahan flagged clinically significant findings in 9 patient cases over 11 weeks. In every case, the outcome data supports the accuracy of her assessment. In 4 of those cases, attending physicians initially dismissed her concern. He paused. In 3 of those 4, the patient required escalated intervention that the dismissal delayed. Silence. In the case of Tricia Lohman, Breck continued, the delay was 40 minutes. In Bernard Solis yesterday, the attending recognized the flag and escalated immediately. He set down the outcomes document. In the case of Renata Moss last night, Dr. Asher acted on Nurse Callahan's assessment within 6 minutes. Moss is in neurosurgical ICU, prognosis favorable. Stokes said nothing. I also received this morning the formal communication from Naval Regional Medical Command, Breck said, which includes both Commander Voss's incident report and a declassified summary of Nurse Callahan's service record, which I'm going to ask her permission to share with everyone in this room. Everyone looked at Nora. Yes, she said. Breck passed copies of the summary around the table. Nora did not watch people read it. She looked at the window, at the gray morning outside, at the parking structure visible across the ambulance bay. She knew what the summary contained. She had written part of it once, in a different context, for a different purpose. in a period of her life that felt like another person's history. It contained her classification rating, which was the highest tier available in her specialty. It contained the number of documented critical interventions, which was a number that made Renee Farkas from the board inhale slightly when she reached it. It contained the commendations, 5 of them, from commanding officers whose names were partially redacted but whose ranks were not. And it contained, in neutral clinical language, the description of the incident that had ended her deployment, a multi-casualty event in which she had performed simultaneous life-critical interventions on 4 injured personnel under active hostile conditions and in which she had sustained injuries of her own that she had not disclosed until the extraction was complete. It also contained, in a separate appended section, a paragraph that Captain Elroy had apparently added in the previous 24 hours, which Nora had not read before. She watched Breck reach that paragraph and his expression shift. Captain Elroy writes, Breck said, setting down his copy, that Nurse Callahan's performance in the past 48 hours, which she summarizes as encompassing 1 vascular trauma management and stabilization, 1 acute M1 variant identification, 1 subarachnoid hemorrhage identification, and 1 field pneumothorax decompression, represents a clinical contribution that she says, and I'm quoting, any emergency medicine program in the country would struggle to replicate with its entire on-staff team. He paused. End quote. The room was very quiet. Stokes' hands, on the table, had not moved. Farkas looked at him. Raymond, she said, can you walk me through your reasoning for the inquiry filing? It was not a question. It was the kind of sentence that wore a question's grammar as a courtesy. Stokes looked at Farkas. Then he looked at Osei. Osei, the outside counsel, gave him the very slight, very specific nod of an attorney signaling to a client that the next thing the client said needed to be chosen carefully. I followed standard protocol, Stokes said. A non-physician performed clinical intervention in my department. The inquiry was procedurally appropriate. The intervention was authorized by the hospital director, Farkas said. In my assessment, Director Breck's authorization exceeded his clinical authority. And yet the patient survived. That's not the... Raymond. Her voice was patient in the way that very experienced people were patient, which was not warm. I have an outcomes document that shows 9 cases over 11 weeks in which your department's response to a qualified clinician's clinical input was dismissal, followed, in multiple cases, by negative patient outcomes. I have a military record that establishes that clinicians' qualifications beyond any reasonable professional dispute. And I have an inquiry that you filed at 5:15 in the morning, before the sun came up, after a patient survived a procedure that your department was not equipped to perform without her. She looked at the inquiry document. Help me understand how this protects the hospital. Stokes did not answer immediately. When he did, his voice was different, lower, without the architectural quality it usually had, without the structure he built around it. It doesn't, he said. It doesn't protect the hospital. He stopped. Then, I was protecting myself. Nobody said anything. Nora looked at him. He was looking at the table. He was a 53-year-old man who had built a professional identity over decades on the premise of his own authority, and that identity had just been measured against something it couldn't account for, and the measuring had been public. And he was sitting in the wreckage of the measurement with a room full of people watching. She did not feel satisfied. She had thought she might when this moment came, and she didn't. What she felt was something more complicated and less clean, something that recognized the humanity in watching a person understand that they had been wrong for a long time about something fundamental, and that the understanding was going to cost them. The inquiry, Farkas said, will be withdrawn, as of today. She looked at Breck. I'd also like a recommendation from you by Friday on the appropriate review process for department management in emergency trauma. A formal review, with outside oversight. Breck nodded. Farkas gathered her documents. Raymond, she said in the same patient voice, I think you should plan to work with HR this week. Not, she anticipated his response, not a termination process, a performance review framework. What you do with your department going forward is going to matter more than what happened in the past 11 weeks. But the past 11 weeks happened, and they're in the record now, and that's not going to change. Stokes nodded once. His jaw was tight. His hands were still on the table. Nora, Farkas said. Nora looked at her. What would you like? Farkas asked. From this department, going forward. The question was genuine, which Nora hadn't entirely expected. She thought about it honestly. Adequate supply levels in Trauma Bay 2, she said. Farkas blinked. And a clinical pathway for nursing staff to escalate concerns that doesn't require a physician's prior agreement, Nora continued. Formal, documented, available to everyone. Not just me. She paused. The 3 patients we delayed treatment for, they could have been anyone else's patients. They were lucky. That's not good enough. Farkas looked at her for a moment. Then she wrote something down. I'll have the policy team draft something by the end of the month. Thank you, Nora said. The meeting ended. People filtered out. Farkas and Osei together, Phyllis Garrett without looking at anyone, Breck pausing to tell Nora he'd have the supply authorization sorted by end of day. Stokes was the last one in the room. Nora was gathering her jacket from the back of her chair when he spoke. Last night, he said, in the waiting room. His voice was quiet. Not apologetic in the rehearsed sense, but the way someone spoke when they were working out what they actually wanted to say as they were saying it. I realized I had gone down there to ask you to keep it private. The things I said to you, how I treated you. He paused. I told the charge nurse I was there to offer an explanation. That wasn't accurate. She looked at him. I was there to ask a favor from someone I treated badly, he said. That's not an apology. That's just more of the same thing. She picked up her jacket. Are you apologizing now? He was quiet for a moment. I'm trying to figure out how to do it honestly, which is taking longer than I expected. He met her eyes. I dismissed you because you didn't perform deference, because the competence underneath the compliance felt like a challenge. And I don't manage challenges well when they come from people I've decided aren't a threat. He paused. Trisha Lohman was in the hospital for 3 days because I delayed. I've known that. I've been managing the knowing of it since it happened. She went home, Nora said. Yes. That's what I cared about. I know, he said. That's part of what I'm apologizing for. That it didn't matter to you whether you got credit, and it mattered to me so much that it overrode everything else. He stood up. You're better at this than I am. Not just the procedures, the whole thing, the actual reason you're here. He picked up the inquiry document from the table. I'll withdraw it formally before noon. He walked out. Nora stood alone in Breck's conference room. She thought about what Tully had said in the alley, with a partially collapsed lung and 22 hours of managed pain and the specific coherence of a person who had been alone too long. There are a lot of nurses here. She almost smiled. She put on her jacket and walked out of the conference room and took the elevator down to the trauma level and arrived to find Marcus at the charge desk with the look of someone who had been watching the clock. Well, he said. Inquiries withdrawn, she said. Bay 2 is getting a supply authorization, and there's going to be a formal escalation pathway for nursing staff. He stared at her. Nora, that's actually... The PAR levels for chest tube trays were still off this morning, she said. Can you pull the supply requisition? He stared at her for another second. Then he laughed. A real one, not performed. The laugh of someone who had decided to find something funny because the alternative was being overwhelmed. Yeah, he said. Yeah, I'll pull the requisition. She was halfway to the trauma bay when her phone rang. The Seattle area code. Elroy's direct line. She answered it. I heard the board meeting went well, Elroy said. Word travels fast. We have good communication channels. A pause. Have you thought about the offer? I've thought about it. And? Nora stood in the corridor outside the trauma bay, through the window of which she could see Yolanda Park at the monitoring station and a new admit coming through the bay doors, and the ordinary organized motion of a trauma department doing its work. She thought about Aaron Tully in an alley with a failing lung, asking for her by name. She thought about Renata Moss going to the cath lab with a thunderclap headache that everyone else had almost missed. She thought about Voss, in recovery, on the slow road to walking again, telling someone that the blue whale's heart was large enough for a person to crawl through its aorta. She thought about what she told Ochoa. It was over. It was another life. She had believed that. She wasn't entirely sure she believed it anymore. I need a condition, she said. Name it. The program, she said. The post-deployment clinical support. I'll consult. I'll develop the assessment protocols. I'll work with your team, but it's part-time. She looked through the window at the trauma bay. I keep this. A pause. Longer than Elroy's pauses usually were. Then, that's not what we designed the position for. I know. Another pause. Let me talk to the program director, Elroy said. I'll call you back today. The line went quiet. Nora put her phone in her pocket. She pushed through the trauma bay doors and went back to work, and she was 14 minutes into a patient assessment when Marcus appeared at the bay entrance with an expression that she had not seen on him before, something between urgency and something else, something that made him look like a person who had just received information and was actively uncertain how to deliver it. What? She said. There's a man at the main entrance, Marcus said. Not a patient. He came in a car and he's asking for you. He said, Marcus paused. He said to tell you he's Tully's commanding officer. Nora looked up. Not Ochoa, Marcus added. Someone above Ochoa. He's in civilian clothes, but he shook his head slightly. Nora, he came with 2 other people, and one of them is in uniform, and the other one... He stopped again. The other one is from the hospital board, Renee Farkas. They came together. She looked at him. And he's carrying a document, Marcus said. A sealed document. And he said it's for you, and he said it can't wait, and he said... He looked at the paper in his own hand, the message he'd written down. He said to tell you that this isn't a job offer. He said you'd understand the difference. The trauma bay continued its work around her, monitors beeping, the new admit being assessed, Yolanda documenting, the ordinary machinery of a place that didn't stop. Nora pulled off her gloves. Tell him I'll be there in 2 minutes, she said. She took off her gloves, dropped them in the waste bin, and walked out of the trauma bay. The main entrance lobby at Callaway General was not a dramatic space. It was the entrance lobby of a regional hospital in a mid-sized Oregon city. A security desk, a bank of chairs, a wall-mounted directory, floors that were clean from being cleaned constantly, not from being new. It smelled like every hospital lobby smelled, which was like nothing specific, which was itself a specific smell. The man standing near the security desk was in his late 50s, in a dark coat over a collared shirt, with the kind of bearing that didn't come from posture exercises, but from decades of being the person in the room that other people organized themselves around. He was not in uniform. He didn't need to be. The uniform was in how he stood. Beside him was Renee Farkas from the board, and beside her was a woman in navy dress uniform that Nora recognized after half a second as Captain Dana Elroy, which meant Elroy had been on a plane last night or very early this morning, which meant this was not a conversation that could happen by phone. The man with the sealed document looked at Nora when she came through the lobby doors, and something in his expression settled, the way expression settled when a person had been looking for something and had found it. Nurse Callahan, he said. Yes. I'm Rear Admiral Thomas Vance, Naval Special Operations Command. He held out the sealed envelope. This is for you. She took it. The seal was official, the kind of official that required specific authority to apply. She broke it and opened it and read the document inside, which was 3 pages, and she read it standing in the lobby with Vance and Elroy and Farkas watching her, and the security guard at the desk pretending not to watch. The document was a formal recognition citation from the Naval Special Operations Command, co-signed by the Surgeon General of the Navy, recognizing Nora Callahan's actions over 48 hours at Callaway General Hospital and in the surrounding area, specifically the vascular stabilization and OR preparation for Commander Voss, the identification and escalation of Petty Officer Tully's penetrating chest injury, and the field needle decompression performed under exigent circumstances that preserved Tully's life while emergency response was arranged. The language was formal and precise and used the specific vocabulary of her former world: tactical medical intervention, exigent field conditions, preservation of life under non-standard operational parameters, and reading it felt like a door she'd thought was fully closed, opening a few inches to let the light through. At the bottom was a handwritten line, not printed, written. You were never just a nurse. You were never just anything. Jivas. She folded the document carefully and put it back in the envelope. There's a ceremony component, Vance said. If you want it, public recognition at the Naval Regional Medical Command level. We'd invite the hospital, the board, your department. He paused. You don't have to want it. She looked at him. What's the non-ceremony component? The non-ceremony component, Elroy said, is that the citation goes into your permanent record, declassified at the level we discussed, available to any institution that requests your professional history. A beat. Including this one. Nora understood what Elroy was doing, which was ensuring that the next time someone tried to build an administrative case against Nora Callahan using institutional ignorance as a lever, the lever wouldn't work. The record, fully documented, would be the answer to every question before it was asked. I'll take the ceremony, Nora said. Vance nodded. 2 weeks. We'll coordinate with Director Breck. She looked at Farkas. The board is here. The board is here, Farkas confirmed, because when the Naval Special Operations Command calls to say they're coming to present a recognition citation to a member of your staff, you show up. She looked at Nora directly. We also wanted to tell you in person that the policy framework you requested, the nursing escalation pathway, has been fast-tracked. Draft version is ready for review, and we're piloting it in the emergency department first. She paused. Your input on the draft would be appreciated, if you're willing. I'm willing, Nora said. Farkas nodded once. She looked like a woman checking something off a list that had weighed on her, and the checking off looked like relief. Good. She glanced at Vance, then back at Nora. The board would also like to formalize your role here. Not supply management, not backfill coverage. A designated senior clinical specialist position in emergency trauma, with the salary and authority that comes with it. She said the number. Nora did not react to the number. That's not why I'm here, Nora said. I know, Farkas said. That's partly why we're offering it. The formal board review of Dr. Raymond Stokes happened 11 days later, on a Tuesday, in a conference room on the 5th floor that Nora was not in and had not been invited to, which was appropriate because it was not about her. It was about him. It was about the clinical outcomes document that Breck had commissioned, and the documented pattern of dismissed nursing flags, and the case file on Tricia Lohman, and the question of how a trauma department had been run for years in a way that systematically ignored clinical input from qualified nursing staff because the person running it had conflated authority with competence. Nora knew about it because Marcus told her the way Marcus told her things, which was at the charge desk over bad coffee with the directness of someone who had decided that the information was hers to have. 3 hours, Marcus said. The review took 3 hours. What was the outcome? He's removed from the department chief position. He wrapped his hands around his cup. Effective immediately. They're pulling in an interim chief from outside while they do a national search. Stokes stays on as an attending. Reduced scope, supervised case reviews for the next 6 months, mandatory departmental ethics training. He paused. And the cases. Lohman, the D-dimer patient, 2 others that came up in the review that I didn't even know about. They're opening formal quality review processes for all of them. The patients are being notified. Nora was quiet for a moment. That's hard for them. Yeah, Marcus said, it is. It's the right thing. Yeah, he said again, it is. She drank her coffee. The tricky thing about justice she had always found was that it didn't feel like winning. Winning was a clean thing, a scored thing, a thing with a final number. Justice felt more like the aftermath of something, messy and incomplete and still containing the wreckage of what had made it necessary. Stokes was going to continue practicing medicine in this building, and that was going to be strange for a while. And the patients who'd been affected were going to receive notifications that would disturb them, and none of that felt clean. What it felt like was true. And true was better than clean, in her experience, even when it was harder. She found out later, not from Marcus, from Yolanda, who had heard it from one of the administrative assistants, that after the review board dismissed him, Stokes had stayed in the conference room for 20 minutes alone. That when he came out, the administrative assistant had been there, and he'd asked her if she knew where Nora Callahan was working today. The administrative assistant had said she didn't know. Stokes had said, "All right," and walked to the elevator and gone back to his office. Nora did not know what she would have said if he'd found her. She thought about it occasionally over the next few days and didn't arrive at an answer. There are limits to what language can do with some things, and the relationship between a person who had the power to diminish someone and the person who had been diminished was one of those things. The formal apology had happened in Breck's conference room. Everything after that lived in territory that words could gesture at but not resolve. She decided that was okay. Some things you carry forward as information, not as weight. Aaron Tully was discharged from Callaway General after 4 days, which was faster than Nora thought the pulmonology team would clear him, but consistent with his personality, which she had assessed from the alley as someone with a very high tolerance for discomfort and a very low tolerance for being stationary. He came to find her before he left. She was in the supply room, Bay 2, checking the chest tube tray inventory that had been properly restocked for the first time in weeks, when she heard the door and turned to find a young man in civilian clothes with a fading bruise along his left jaw and the slightly careful posture of someone whose intercostal muscles were reminding them to be thoughtful about sudden movements. "You're supposed to be doing discharge paperwork," she said. "Done," he said. Rios did it fast. He stood in the supply room doorway with his hands in his jacket pockets and the expression of someone who had practiced what they wanted to say and was now finding that the practice version wasn't quite right for the room. "Ochoa told me what you did. In the alley. Ochoa talks too much." "He really doesn't," Tully said. "He talks exactly the right amount. He just talks about things that matter." He looked at her directly. The directness was effortful, she could tell, not because he lacked it, but because whatever he wanted to say was something he hadn't said out loud before and wasn't sure yet how it sounded. "I want you to know, when I was in there, I knew something was wrong. I knew it since that morning. I kept thinking I'd walk it off." People do that. "I kept thinking it was weakness," he said, "to need help. To be the guy who... We got Voss out, and I thought if I said something it would be about me, and it shouldn't be about me." Nora set down the inventory clipboard. "How many people did you help evacuate that night?" He looked at her. 3. "While injured." A pause. "Yeah." "Aaron," she said, "the system that taught you that asking for help is weakness is the same system that left you in an alley for 22 hours with a collapsing lung." She said it without heat, without judgment, just the flatness of a fact. "You're not less for needing the chest tube. You're not more for not asking. You are exactly what you are, which is someone who did hard things under hard conditions and then needed medical care, and both of those can be true at the same time." He was quiet for a moment. "They're sending me to the program," he said, "in Seattle, the one Captain Elroy runs." "I heard." "She said there's a clinical specialist coming on part-time." He paused. "She said the protocols are being rewritten." "They are." He looked at her. "Is it you?" She looked back at him. This 26-year-old man with a bruised jaw and 4 days of hospital oxygen and a whole career ahead of him that was going to keep asking things of him that most people would never be asked. "Part of it is me," she said. Something in his face loosened, very slightly, in the way that a person's face loosened when they received information they hadn't known they were waiting for. He nodded once, the specific nod that meant something had been confirmed. "Okay," he said. "That's... okay." He left. She went back to the inventory. The recognition ceremony at Naval Regional Medical Command in Seattle happened on a Friday, 2 weeks and 3 days after the night the helicopter landed on the roof. Nora drove up that morning. She had been offered a car, an escort, 2 different offers of someone to accompany her, and had declined all of them. She drove north on the interstate in her own car with the radio on a station that played older music, the kind with space in it, and she drank coffee from a travel mug and watched the Oregon landscape turn into Washington landscape, which it did gradually enough that you could argue about where exactly the change happened. She wore her own clothes. Not scrubs, not a uniform. A dark blazer over a gray shirt, the most formally she'd dressed in months, and it fit correctly, and she thought that was sufficient. The ceremony was in a large room at the command facility, with enough chairs that the space felt populated without feeling crowded. The naval personnel were in dress uniform. The Callaway general contingent had come up. Breck was there, and Farkas, and Huang, and Marcus, who had driven up at 5 a.m. because he said he wasn't going to miss it, and had offered no further explanation. Yolanda Park was there. Asher was there. Even Hartwell, standing near the back with the expression of someone who understood that his being here mattered more than it was comfortable to admit. Dr. Raymond Stokes was not there. She had not expected him to be. She had not invited him and had not been asked if she wanted to invite him, and that was its own kind of resolution. Not hostile, not dramatic, just the simple fact that this particular room was not his. Commander Garrett Voss was there. He was in a wheelchair, which she could tell he was not happy about from across the room, and his left leg was in a brace, and he was talking to someone from his team with the focused engagement of a person who was absolutely present in a space even when their body was temporarily limited. When he saw her, he stopped the conversation mid-sentence and watched her cross the room, and his face did the complicated thing it had done when she'd stood over him in the trauma bay, the thing that was too layered to be a single emotion. "You look different," he said. "You look alive," she said. "The bar," he said, "continues to be on the floor." "You were at your most charming with 67 minutes of field compression on your femoral region," she said. "It's been slightly downhill since." He laughed. It was a real one. The laugh of someone whose body still registered laughter as a physical event that engaged muscles he was currently working to rehabilitate, and he absorbed the wince that came with it without commenting on it. "How long are you up here?" he said. "Today?" she said. "I have a shift tomorrow." He looked at her. "Elroy said you're going part-time with the program. Consulting, protocol development, some assessment work. And the rest of the time you're in Calvert City counting gauze." "Stocking trauma bays," she corrected. "The gauze levels are fine now." He was quiet for a moment. There was something he wanted to say that he was taking his time approaching. She waited, because she had learned a long time ago that the things people took their time approaching were usually the things worth waiting for. "I've been thinking about what you said in the elevator," he said. "About it being another life, about choosing to be a nurse. And I spent 2 weeks in a recovery room thinking about it," he said, "which is a lot of time." He shifted in the wheelchair, a small adjustment of position. "I think you were right that it was a choice. I think I spent a long time not understanding that the choice was the whole point." He paused. "Most people do the thing they're good at because they're good at it. You chose the version of what you're good at that put you in the room with the people who needed it most, with no recognition, no rank, no institutional protection. You chose the version that was just the work." She didn't say anything. "That's not small," he said. "That's not hiding. That's actually—" He stopped. "I don't have a good word for it." "It's what I needed to do," she said. "That's all." "I know," he said. "But the thing you needed to do kept a lot of people alive. So I'm going to say it mattered, and you're going to have to tolerate that." She looked at him for a moment. This man who had been dying on a gurney 11 days ago, who was going to spend months learning to use his leg again, who was sitting in a wheelchair at a ceremony for someone else with the full weight of his attention directed at her. "Fine," she said. "It mattered." "Thank you," he said. "That was painful for both of us." She almost laughed. Rear Admiral Vance read the citation aloud. The room was quiet in the specific way that rooms were quiet, when people were listening to something they understood was important, not performed quiet, but real. The silence of people giving their attention to words that had weight. Vance read it clearly and without performance, the way official language worked best, allowing the content to carry itself. When he reached the section on the alley and Tully's decompression, she heard Marcus shift in his chair, and when she glanced sideways, she saw him looking at the floor with the particular contained expression of someone managing their face deliberately. She looked forward. Elroy came to the podium after Vance. "I want to say something that's not in the citation," Elroy said. "The citation documents what happened, I want to say something about how it happened. She looked at Nora. Nora Callahan came back into a clinical environment and chose to practice quietly, not because she didn't know her worth, because she understood that worth isn't something you announce. It's something that becomes visible when the room needs it. She didn't push. She didn't advocate for herself. She just showed up and did the work and trusted that the work was the point. A pause. And when everything failed around her, the institutional hierarchy, the professional courtesy, the basic recognition that she was looking at something the others weren't, she stayed. She did not leave. She did not withdraw. She stocked the supply carts and came back the next shift and the next one because the patients were there and the patients needed the work, and the work was more important than being right. Elroy stopped. That is the hardest thing to do. Anyone who tells you differently hasn't tried it. The room was quiet. Nora sat in the front row of chairs with the citation envelope in her hands and thought about the supply room at 6 a.m., counting gauze in the dark. About Trisha Lohman's butterfly tattoo. About the elevator, 11 seconds, holding compression with one hand. About Tully in an alley with his head against the wall and the specific relief on his face when she'd said his name. About what it had cost her to stay. About what it would have cost her to leave. She thought about a lesson she hadn't been taught anywhere, hadn't read anywhere, had arrived at through the specific curriculum of being in rooms where the work was real and the stakes were real and the structure around it sometimes failed. The lesson that you couldn't control how a room received you, but you could control what you brought into it. That the quality of your attention was your actual authority. That the people who needed you didn't care about your title or your institutional position. They cared whether you saw what was happening to them, whether you stayed when it got hard, whether your hands knew what to do. She had tried to be that person. She had not always succeeded. She had made calls that were close, compressed diagnoses that could have gone either way. Moments in the alley with Tully where the catheter placement was good but not textbook perfect. Moments in the elevator where she'd felt the ground of her certainty shift under her and had chosen to act anyway. She was not the version of herself she was in other people's narratives. Not the quietly perfect superwoman, not the saint who bore insults with grace. She was someone who had been angry and tired and frightened, who had stood in supply rooms at 6 a.m. and asked herself if this was the right decision, who had made choices about what to bury and what to keep, and had been wrong about some of them. She was someone who had stayed. That was the whole of it. Vance handed her the formal citation box and shook her hand and said her name, and the room came up. Not a standing ovation, which would have been too much, but people rising from their chairs because they were moved enough that sitting felt insufficient. And she stood at the front of the room and received it without looking away, which was its own kind of discipline. Marcus was standing. Of course he was. Huang was standing. Asher, Yolanda. Breck with his reading glasses pushed up, and his expression doing the thing where he was moved and was being professional about it with only partial success. Voss, from his wheelchair, was not standing. But his hands were together, and his face, the one she'd learned over 11 days, the one that was not easy to read but had specific tells, was carrying something that had no military vocabulary, something that was simply the expression of a man who was alive because of the person standing at the front of the room and knew it, and was not going to pretend otherwise. She nodded to him. He nodded back. She drove home that afternoon. The ceremony had ended at noon. There had been a small reception, food she half ate, conversations she was genuinely glad to have, Tully showing up in civilian clothes with his arm still slightly guarded and shaking her hand and saying nothing else, which was perfect, which was exactly right. She drove south as the afternoon moved toward evening, the highway carrying her back through the border between Washington and Oregon, the landscape she had come to know as the texture of her current life. The city spread out below the final ridge of elevation before the descent into Calvert City, the hospital visible as a shape in the middle distance with its specific roofline. She thought about Elroy's offer. She had agreed to the part-time consulting. She had not agreed to more than that, and Elroy, to her credit, had not pushed, had simply said that the door remained open and that the protocol drafts would be waiting when Nora was ready to work on them. She thought about Stokes, in a reduced role, learning or not learning because people were not guaranteed to learn, even from things that hurt them. How to be in a department that was changing around him. She thought about the formal ethics training requirement, which was either going to be genuinely instructive or a bureaucratic performance, and she couldn't know which yet, and it wasn't her problem to manage. She thought about the escalation pathway policy draft sitting in Farkas's inbox, about the nursing staff at Callaway General who would be able, starting next month if the draft moved fast, to flag clinical concerns through a formal channel that didn't require a physician's prior approval, about the cases that might not be delayed because of it, the patients who might be Tricia Lohman, who might be Bernard Solis, who might be Renata Moss, petty, ordinary people in ordinary emergencies, lying in bays under fluorescent lights, needing someone to pay attention. She pulled off the highway at the Calvert City exit. The hospital was 20 minutes from the exit. She had driven this route enough times that her hands knew it without deliberation. The turns automatic, the familiar landmarks passing without demanding notice. She thought about what she was, in the sum of things. She was a nurse. That was still the truest sentence. Not former Navy, not decorated specialist, not the person who had kept 3 special operators alive in 48 hours. Those things were true, but they were chapters. And chapters were not the whole of a person. She was a nurse who showed up and paid attention and had learned over a long and uneven and sometimes costly career that the work was the point, that the work was always the point, that the room respected the loudest person or the most titled person until the moment the situation required the competent one, and then the room rearranged itself around reality, and reality was always the person with the best answer to the problem in front of them. She was not exceptional because of what she'd been trained to do. She was the person she was because she'd chosen to keep doing it when nobody was watching, when nobody was awarding it, when the reward for being right was getting moved to the supply room. That was the part she wanted to keep, not the ceremony, not the citation in the sealed envelope on her passenger seat, not the title that Farkas had offered and that she had accepted with the specific understanding that a title was an instrument, not an identity. The part she wanted to keep was the supply room at 6 a.m., the gauze that needed counting, the par levels that nobody else had noticed were wrong, the small, unglamorous acts of care that added up, over weeks and months, into the difference between a department that worked and one that failed, between a patient who went home and one who didn't. She had not been invisible in that supply room. She had been paying attention. The hospital came into view as she turned onto the main approach road, its lights visible in the early evening, the ambulance bay lit, the roofline clean against the sky. Ordinary. Familiar. The place where 3 months ago she had arrived with a resume no one read carefully and a history she had put in a box, intending to be just a nurse, intending to be nothing more than what the work required. She had gotten exactly what she intended, and somewhere in the getting of it, exactly what she was had been enough. She parked in the staff lot. She sat for a moment with the engine off and the citation envelope in her hands. Then she put it in her bag and got out of the car and walked toward the building, because she had a shift tomorrow and the trauma bay trays needed a final restock before the evening team handed off, and somebody had to care about that. She had always been somebody. It had just taken the right moment for the room to turn around and see it. The quietest people in any room are not always the least important. Sometimes they are the ones who have already survived the things the room hasn't had to face yet, who carry the weight of it without display, who show up without announcement, who do not need the room's recognition to know what they are worth. They simply stay. They do the work. And when everything else fails, they are the ones the room turns to. Not because they finally spoke up, but because they never stopped showing up, even when no one was looking. That is not silence. That is the most powerful thing a person can do.